And we are live in about 20 seconds here.
Thanks very much, Neil. All right, I think we're live now. Neil, while I still got you there, if you could promote me to co-host, that would be great as well. And with that, we'll start our October 18th regular council meeting. And I'd like to first acknowledge that we are meeting on unceded traditional territories of the Comox First Nation. And I'd like to thank them for welcoming us here. First up, we have the adoption of minutes.
Move adoption.
Second.
Excellent. And that's been moved and seconded. Any questions, comments, or corrections for the minutes? Seeing none, unless anybody has any issues, we'll move minutes adopted unanimously and move on to the next, which is introduction of late items. And I don't believe that there are any late items. And moving on to delegations, we're going to start with Walk With Me, the Independent Research Project. And I'm going to pass it over to Sharon Karsten. And I'll let you introduce everybody, and you guys you have about 10 minutes to let us know what's happening.
Thanks, Mayor and Council. I'm just going to share my screen here. We're working on it here.
Something's happening.
All right, we can see your screen now. It's looking good.
Awesomeness. Thanks.
Remember to always blame it on the computer, but it's over to you.
Awesome. Thank you, Mayor and Council, for accepting our delegation. We're excited to be here on behalf of the Walk With Me research team. And before we begin, I'd just like to ask our elder and knowledge keeper, Barb White, to welcome us to the territory.
Thank you, Sharon. My name is Barb White. I was born Barb Billy. I'm a descendant of the Pentlatch people on my father's side, descendant of the Kwantlen people on my mother's side, who was adopted from the orphanage at residential school into the Comox First Nations. On behalf of the members of the Comox First Nations, I'd like to welcome you to the unceded territory of the Comox people, all my relations.
Thank you, Barb. I just also like to introduce those that are presenting with me. To my right, we have Sophia Katsanikakis. Do you want to introduce yourself?
Hi, my name is Sophia. I'm the communications coordinator with the Walk With Me project. I've been involved for about a year now, and I'm very happy to be here. Thank you.
Thank you. We also have Darcy Honey.
Hello, everybody. I'm Darcy Honey. I'm also the cultural support coordinator for the Walk With Me, and I'm also happy to be here and move forward with you. Thank you.
Thanks. And can I please introduce Sarah Delaney Spindler from AVI Health and Community Services.
Thanks, Sharon. Hi, everyone. My name is Sarah. I am the manager for AVI Health and Community Services in Courtenay and Campbell River.
Thank you. I just want to give an update on the Walk With Me project. The purpose of this presentation is to speak to this report that we've just produced on behalf of our research team that documents this, the voices, the experiences that were gifted to this project from the lived experience community in the Comox Valley. Just a little bit about this project. It's a community action and social change project. It comes through an unconventional means in that the art gallery, the Comox Valley Art Gallery, started this project back in 2019 when we started grappling with the massive toll that the toxic drug poisoning crisis was having on people in our community, on youth, on artists that we were working with. And we wanted to know what an art gallery could do to make change. And so I'm also a researcher. I work through Thompson Rivers University as an adjunct faculty member. And we brought in Thompson Rivers University. We approached AVI Health and Community Services. We approached our medical health officer, and we asked what could be done to start to better understand the human dimensions of this crisis. And so over the course of 2 years, we sat with people with lived and living experience of this crisis, with frontline workers and with family members. And were gifted powerful insights about the way in which the crisis has unfolded here in the Comox Valley. And so today we're here to speak to those insights just a little bit because we only have 10 minutes, but also to point you to the report, which is on our website, walkwithme.ca, and to engage any questions you might have about the project. I want to say that when we first started this work, we approached the Drug Strategy Committee and we presented the idea. We received support, a letter of support, with the understanding that our work would come back and that we would present our findings back to Mayor and Council. So here we are, this is a full circle. It's been 2 years since we made that presentation, and we're just presenting these in the hope that the recommendations will be received in a good way and will make a difference. So yeah, I just want to begin by just pointing to some of the statistics, like why does this crisis matter? So many will know that there are 2 provincial health emergencies at play right now, COVID-19 and the toxic drug poisoning crisis. Since 2016, this crisis has been labeled a provincial emergency. And in 2020, enacted almost triple the number of deaths as COVID-19. This is a massive crisis that is taking out our loved ones left, right, and center. And I just want to take a moment to honor people that we've lost to the crisis. So if we could just take a quick moment right now, I recognize that for many of us on the Walk With Me team, we have lost 3 people that were on our team since we started this work. I know that many people who are beaming in with us now via Zoom have lost people as well. And I just want to take a moment to honor people that we've lost to the crisis in a moment of silence, if that's okay. So let's just do that now. Thank you. Thank you. Just a little bit about the stats. This crisis is disproportionately impacting men and middle-aged men in particular. The crisis is disproportionately impacting Indigenous people. It's disproportionately impacting people who are unemployed, as well as people in trades and transportation. And these are all stats you'll find in the report as well. So I'm sorry if I'm going quickly. Most people live in private residences, which speaks to the massive amount of shame people are feeling. Most people whose lives are being lost it's happening indoors and with people using a loan. These numbers are outdated now, but they're huge. 17,602 lives lost. This one goes until June 2020. This is across Canada. In BC, it's over 7,000 people whose lives have been lost. And I just want to acknowledge the toxicity of the supply. So 86.8% of BC toxic drug deaths had fentanyl detected in them. I'm just going to turn it over for a moment to Sophia, who's going to take you through what we went through over this last couple of years.
So starting in 2019 and going into a large portion of 2020, The Walk With Me team sat in circle with people with lived and living experience of addiction and homelessness, as well as frontline workers, family members, healthcare professionals. And we were gifted stories, verbal stories, which we recorded. We were also gifted artwork. People wanted to draw about their experiences. We also had people who just wanted to come and play music or just sit and share in a more casual way. And what we did with these stories is we were able to craft them into audio journeys. And so we created 3 different audio journeys. This is a picture of the front of the art gallery during that time. And we started in the fall of 2020 to walk with these stories with members of the community using wireless headsets. And we walked through alleyways, we walked through parks, and we took people on a journey while listening to these stories. And the main purpose was to raise awareness of what it's like when you're living on the streets, when you're battling with your addiction. Some people have overcome their addiction. It's just the whole experience. And so we took members of the community on these walks. It was open to everyone. We also had people from council come, from CVRD, from Island Health, and it was an amazing experience. And following each walk, we had a circle out on the plaza where we would share food, and we would give the opportunity for people to reflect and comment on what the experience was like for them hearing these stories. And it was really amazing because we had people, members of the community, we had members of council, we had people who had gifted their stories who were still living on the streets. We had all of these people come together in circle and talk together and share together. And that's something that doesn't really happen too often. So the result from that was really, really amazing and impactful for everyone.
Thank you. I'm just wondering, Darcy, if you want to speak to where we've gone with the project since.
Hi, everybody. I'm Darcy. So I've been with the program for about 6 months now. I'm also somebody that has lived experience on the streets and with drug addiction. Been surrounded by it my whole life, and you know, to see where we've came and where we're going, and with the hospital in Campbell River, with the staff that are there, it's really making a big impact on the staff as well as the people that are on the streets and things like that. For me personally, it's so important to me, just having the stigma and all the comments and just the whole way of being homeless and drug addiction person, and the treatment that you get from it is with the Walk With Me, it's just helping so many people. And you know, the feedback that we get from it is changing people's lives. And as somebody that comes from it, I can see it changes me, it's changing me, and it's a blessing to be part of the program, to see what we're doing and how much change is so important to everybody's lives. So thank you.
Thank you. Thank you. It's just really important to acknowledge that cultural safety is a key part of our work. And I'm wondering, Barb, if you'd want to speak to this at all. Oh, you're on mute, Barb.
Thank you, Sharon. Yes, cultural safety has been a big part of our work, and thank you for bringing that into the project as strongly as you do. Cultural safety helps us to overcome the stigma, and in the circle, we're all equal. We all get a chance to have a voice, and I think that that's really important for us all to have a voice. And the cultural safety that we're bringing in different ways We're introducing people's lives to the people that work in healthcare, especially in Emerge. They don't get any history on the patients that they're working with that come through the door that need the care immediately. And by them coming and doing the walk with me, it gives them a little bit of history as to where they're coming from and what their needs might be other than what they are giving to them in emergency at that time. And it also helps to give them ways to think about referrals into the community and how we can continue to give care to those that they're discharging out of the hospital. And then much, much more of awareness that we're giving to the community for the people that come and participate. So thank you so much.
Thank you, Barb. I realize we need to wrap up here, and I will do that right away. Just want to end by saying, and I know Sarah also, if you wanted to jump in there and just speak to AVI's role before we end.
Sure, I'll real quick just summarize it. So AVI lent their outreach team to support the Walk With Me project. And what this looked like was initially a conduit for connection from the Walk With Me team to people with lived and living experience, because that's who we work with and support every day. So we facilitated the connection between folks and the Walk With Me project. And then once the project got going and people with living experience were incorporated within it, AVI Outreach really held presence for those cultural mapping sessions and provided support and, you know, a familiar face to folks, just to really allow them to show their vulnerable side and let them know that this was a safe place. And the outreach team continues to work with Walk With Me in their hospital walks, as well as now passing the torch to the Campbell River edition of the Walk With Me program.
Thank you, Sarah. And it's huge, the support that has been provided by AVI. So thank you. Just in conclusion, we have a series of recommendations. I would suggest that people read the report for all of the wealth of lived experience that is contained therein. There are powerful quotes, powerful insights and wisdom and observation that have been gifted to this project. And it's really, I don't have enough time here to go through what that wisdom is, but I would just recommend that people take the time to sit with those voices and with what has been gifted to this project, because the voices are powerful. So the recommendations coming forward pertain to things like decriminalization and safe supply. And just to be clear, there are two different approaches to decriminalization, and we're advocating both, one of which involves lobbying the federal government to itself change the laws to decriminalize, and the other of which is an initiative that the city of Vancouver has recently done, which is to advocate for the criminal code to be revoked within their municipal boundaries, such that decriminalization can occur within those boundaries. So we're advocating for both of those initiatives to happen. Reducing and eliminating stigma, creating people with lived and living experience leadership group within the city, pursuing ongoing improvements in housing, mental health, education, conducting gaps and opportunities analysis within the Comox Valley. For instance, there's huge gaps right now in areas related to harm reduction, people not being able to access harm reduction, huge gaps related to detox and the lack of a detox center, a medical detox, huge gaps in housing and second stage housing. There are huge gaps, and you'll read about these in the report. So some of these are sort of easier to act on than others. Many require a concerted effort to bring multiple community leaders together into conversation. And so we're putting these recommendations out there as a stepping stone, a first step towards those conversations. So yeah, that's our presentation. I think if I could just leave with one pitch, we'd like to invite Mayor and Council to walk with us. And so I will be sending out an invite in the next 2 weeks to start that conversation. Thank you.
Thanks so much, Sharon, and thanks Darcy and Sophia, and I've spoken with Sam in the past. Barb, thanks for your words at the beginning, and Sarah, I do appreciate everyone. I think I've captured most of the people that spoke today, and I'm sure that there may be some questions from council. So I'll start with Councillor Cole Hamilton.
Great, thank you, Mayor. And thank you very much, everyone on the Walk With Me team. I had the opportunity to do the walk earlier this year, and I have to say it was one of the more powerful experiences I've had in a long time. And I thank you for the vision of finding a way of putting that together and bringing it to people in a way that I think makes the crisis very concrete. I just wanted to look at a couple of the suggestions for local government, and I appreciate having some fairly concrete suggestions to look at. I think one of them was particularly interesting to me was about having perhaps an advisory committee of people with lived and living experience. And while we don't act on delegations the evening they happen, I can certainly see this being something that would be worth exploring to see if that is something we could implement here. I think it's if we want to create equitable and effective policy responses, we do need to hear from the people who are affected and involved. And I was just wondering if you have any examples of that in practice going on that we could take a look at in order to inform ourselves more about how a group like that would engage with the municipal council.
Mm-hmm. I'm aware mostly of lived experience communities within Island Health. And I know that there's a whole bunch of experimentation happening right now around what the role of those committees are and how their wisdom is brought forward. Sorry, Sarah, you have thoughts on this?
Yeah, one thing I'd just like to put forward on that, I think that's amazing, the recognition of the peer advisory groups and the value it brings. So AVI supports a local peer group, Comox Valley Street Outreach. And within that peer group, there has often been talk of how do we as peers engage with our local government, and they don't know. So this could be a fantastic connection between local government and a peer group that is already situated and started up. And I would be more than happy to provide connection between the two and facilitate that relationship.
Okay, well, thank you for that. I certainly know as a member of the community action team and the substance use strategy committee that where we've had peer engagement and input throughout, it's been extremely valuable to the process. And I just wanted to note there's another element you're talking about, which was gaps in opportunity analysis. And I was wondering, do you see a role for the substance use strategy in their phase 2 as being a sort of a key component of that gaps and opportunities analysis? Thank you.
Yes, so something I haven't yet mentioned is our ongoing collaboration with the Substance Use Strategy Committee. We, throughout the last 2 years, have been involved in one way or another, even back, like I said, when it used to be called the Drug Strategy Committee. And this recommendation around gaps analysis is to really create a comprehensive map of where these gaps are, where these fissures are in our community. And this is indeed part of our phase 2 strategy, which will be, it's kind of like a second linked report that's coming from that committee later. So you'll hear about that momentarily.
Thank you.
Excellent. Thanks, Councillor Cole Hamilton. And Councillor Killian.
Thank you, Mayor, and thanks very much for the presentation. I haven't had the opportunity to walk with you, but I will gladly accept the invitation when it does come. What I do recall, though, Sharon, is that I think it was actually 3 years ago when you presented in this very chamber to the Drug Strategy Committee regarding your hopes for this project. I remember initially there was some concern about our research project with people involved in this very difficult area, given the trauma that people were experiencing, not only the people whose lives are being claimed by the toxic drug crisis, but by those working with them. And it was gratifying that even the individuals involved were able to talk through that, and the project began to take shape. And I really commend you and your team for the unique and comprehensive piece of work that you've produced. I think that we all have a lot to learn about how to engage with people with lived experience, and I believe that you've given us a template. So I thank you for that, and just really appreciate that this is a step forward in the work that we all need to do together. I was also struck by the information you presented about the fact that this is very much a crisis that is impacting man. And in that regard, along with some other local people, I helped to facilitate a conversation in the late spring regarding men's health issues. And I see that as an opportunity for further engagement with people with lived experience as we try and help our system to perhaps focus more on the unique aspects of reaching out to men in crisis, whether they are on the street or have been laid off or injured in construction and industrial accidents or otherwise. And I'm hoping that perhaps we could work together to further that conversation if that's something that you would see as useful. Thanks very much.
Thank you. Yes, we're absolutely open to that conversation, and the trades and construction industry in particular is highly represented in this area, and we welcome any opportunity, especially given the high levels of stigmatization that exist in those industries, to work in whatever way makes sense with the project. So thank you for that. And I just want to reflect back on a previous comment around the involvement of people with lived experience. This is at the heart of our project, and I am so honored to have met with and to have seen the leadership emerge from this community through this project, through the lived experience community. So I'm so grateful for that, and I just want to say that out loud. Thank you.
Thanks so much, Sharon, and Councillor Moore.
Oh, great. Thank you, Mayor. Thank you so much for the presentation. The report was incredible. So many aspects to kind of dive into. One of the things that I found interesting was the various comments by physicians who've worked in this field for, some of them 20 plus years, and how this crisis, particularly with fentanyl, is like no other. I mean, we know for throughout history, people have used substances, and really the percentage of people who have difficulty with substances, it hasn't really changed too much, but the deaths obviously are occurring like something we've never seen throughout history. And the doctors who were interviewed really drove that point home. And I think that is important to the stigma conversation, because I think there's a sentiment out there that people can just get over this, and if you work hard enough and you're motivated enough, you can kick it. But this is an ugly poisoning situation that is not easy to get through. And I think having physicians tell their, with the science-based information along with the lived experience is really powerful. And I guess on that note, I'm wondering if you have some ideas on, I mean, you're presenting this to us today. I know many of us are sharing this information in our circles, but I'm wondering how do you anticipate being able to get this information to people who really, really need to hear these stories, because we know that that there are so many people, in workplaces, in young people, parents, the mainstream population really needs to see this. And of course, we know that this is happening in every family. So I'm just wondering if you've got some ideas about how to kind of get this information out there to more people.
Thank you. Yes, so systems change is the goal here. Systems change and community change. And so we have been working, we have been invited and very unexpectedly into Island Health system. So we are working with emergency rooms throughout Island Health, and we're walking with these stories from hospitals. We start on the outside of a hospital and we carve out a path and we walk with frontline staff with these stories. And so we've been doing this work for the last 6 months, but we are also in conversation right now with NIC, where we would love to be in conversation with justice and police. And we would love to be walking with these stories in multiple different systems. And so we've also been invited up to Campbell River to do this work there. And we are working with the substance use strategy, as we talked about earlier. So the work is, there's so much work to do, but we are finding open doors in these systems, and very, very unexpectedly, paths are being made for us to enter into them. So we're grateful for those, but more work is needed, as always.
Thank you.
Excellent. Thanks, Councillor Moran. And I don't see any other questions or comments at this point, but I think that, if we even look back at our council's last meetings over the last few weeks, we've had several meetings with ministers, and whether it's, Minister Osborne for municipalities, Selena Robinson in finance, David Eby around housing, or Sheila Malcolmson, who's actually Minister of Mental Health and Addictions. This has been one of the major points of topic for all of those ministers. So this is certainly something that I think as a municipality, we've done our best to step up and support you in it. And when we talk about those next steps, having a meeting where we maybe have our MLAs there would be really useful. I think our MPs, given the silly configuration we have in the Comox Valley, it does mean that we may have to have 2 of each, just because of the way the ridings work. But it may be worthwhile to call a meeting so that we can have that conversation that is not just the municipalities, and then maybe a separate conversation with the province and a separate conversation with the federal government, but try to have that more cohesive conversation so that message can get through all layers at the same time, and have those communications and discussions happening to see how we can connect the dots to as you say, change the system. So I think with that though, again, we gave you guys a little bit extra time today because we did ask you to do this, and I really appreciate the report. I hope lots of people take a read of it. Again, some very, very challenging issues that we're trying to tackle, and really want to thank you so much, and thank you for your presentation today.
Thank you.
All right. And with that, we'll move on to the Comox Valley Transition Society. And we've got Heather May and Deb Prey. And so everybody else, if you're not part of the presentation, if you want to just turn your video off and make sure your mic's turned off, and then that way we can focus on just the ones that are talking. Thanks so much. And with that, I'll pass it over to Heather.
Hi, good afternoon, everybody. I hope you can hear me. And I'm glad to see you're all there and well, as we are experiencing quite a cluster of COVID in the Comox Valley right now, and particularly with our vulnerable population. So I've been really busy and have nothing really formal prepared. And so I'm just going to talk off the cuff a little bit and invite my colleague, Deb, to share a little bit of her experience with you in just a few moments. Deb is the coordinator at the Travel Lodge and spent a significant amount of time supporting the overnight mats at Connect from the period of February to June this year. So I would follow up on what Sharon and the Walk With Me team is saying about the crisis. We have several crises on right now, the opioid crisis, and the COVID crisis, the homelessness crisis, and also a labor shortage crisis in the Comox Valley and beyond. None of these things are unique to us. And today I just want to speak to the importance that those overnight mats were during the cold weather and even into the spring, and the things that we were able to accomplish with those folks and the relationships that were built. And I recognize the challenges for the neighborhood and some of the businesses, but I think the work that was done there outweighs, and that lots of those challenges have been overcome by the great work of the city with the environmental design and whatnot in the area. So in September at Connect, we had 1,860 not individual people, but interactions with folks accessing services at Connect. And what they're getting there is the doctor's visits, they're getting food, sleep even during the day, access to harm reduction supplies, access to housing applications, and just a whole lot of care in a community and an environment that they often don't get the kind of care that they deserve. And so there is an opportunity, well, maybe before I tell you what's on the table from BC Housing, and I completely recognize that there's a report coming from staff straight away after this about Connect and the use of the space ongoing and as for overnight mats. But first, I just asked Deb if you could chime in and speak to your experience with some of the clients that you met at Connect, and then subsequently what has transpired for them.
Hi, everybody. Good afternoon. So building the relationships at Connect has proven to be very successful. We got to know their strengths, their needs, their community connections, their drug use during the opiate crisis. And we were able to work on this in the 5 months that was open for the overnights. I was able to work really hard with some of these folks, and 8 individuals that were on the overnight program were able to move over to the Travelodge gradually. 7 of them are still there, and they're have been very successful with all the wraparound services that we've been able to give. I do realize that there was challenges at Connect, but I do wish that everybody knew these folks the way we knew them, the way we know them, and have got to know them over this last eight months. We've brought we've met some of these folks as families, and it's been a really good journey for a lot of these folks that have been able to come to the Travelodge. It's more permanent, of course, than Connect, but it has proven to be very successful.
Thank you, Deb. So right now on was the request for the overnight mats to operate out of the Connect building, and with the UBCM grant, and that letter submitted by myself and the coalition a few weeks back. And since that time, the opportunity, BC Housing has come forward and asked us if we could operate out of that space, which I will say we have outgrown, and we could use the whole building, just slide that in there. If we could operate a temporary shelter funded by them 7 days a week? And in addition to that, could we layer on top of that EWR mats when the extreme weather is triggered? So that's the ask. I have spoken to staff about this, but I wanted to verbalize it to you. And I know that there is both building code issues and there's a risk involved given some of those issues. And I know there's a plan to take a look at how they can be resolved, but that takes time. And in the moment, we have a crisis of homelessness. And I just, in talking to some people with lived experience about the risk of fire, is the risk of fire and injury for being outside, living in a tent with candles or propane stoves, all those things, is in my expert field as a fire person, a far greater risk than what we might encounter with a fully staffed, awake, fire watch and all the rest of it in the Connect building. And as you know, I can attest to the fact that fire is a huge risk with homeless people living outside and trying to keep warm, as our thrift store burnt down almost 3 years ago and put $250,000 dent in our budget. And that was because there were people outside trying to keep warm and the building burnt down. And I would suggest that risk continues for the rest of the downtown merchants, but it's mitigated by having those people sleeping inside under watchful eyes. So I'm asking today that we be able to operate outside of the cold weather emergency and operate that overnight mats for the safety and security of our community ongoing and not just because of extreme weather. I also would think that, and my observation is, yes, there was mess outside of Connect, but we looked after cleaning that up most of the time when we were able in the mornings. We continue to have the mess across the street with great number of resources, dollars being put into that. And it's not better because we don't operate overnight now. I, in fact, would argue that it's worse. So that's what I'm asking for. The other thing I would really like your attention on is back to the lack of services, particularly OPS, and what's happening right now in the absence of a inhalation safe use site operated by Island Health as it is. And the fact that the existing injection OPS site has such limited hours, the area around Connect has become the de facto OPS site, and they are using in the area because they know that we are close at hand. The staff are close at hand to respond to an overdose within the staff from the connector within a very short distance and can respond to an overdose crisis for those that are using across the street or on the telestairs or wherever it is. And so we really need to address the absence of that inhalation safe site if we're going to curtail some of the activity that is going on in the area. I have also just want to report that I am on the board of the DCBIA now, so we can build those linkages as well as their safety and security committee so that we can increase the communication. And before I stop, I just want to, really hand it to Kate and Susie and all the work that they've been doing and their availability to us and their understanding of the issue and their desire to find solutions. So I guess I'm just trying to tell you they're not coming fast enough. And I know what we're talking about is not permanent, and we need to continue to have those conversations at the provincial level. because we really do have a serious crisis on our hands. That's it.
Excellent. Thanks, Heather. Right at the 10 minutes there. That was almost like you had that time for something that was, as you said, a little more ad hoc, but really appreciate the presentation. And I do see that Councillor Hilling has a question.
Thank you, Mayor, and thanks, Heather, for the presentation. I particularly appreciate you acknowledging the work of our staff. For those who don't know, the names Susie and Kate that you referenced are two of our senior staff who've been working with you for some time now and trying to problem solve around these issues. I would agree with you that the situation outside in the city parking lot is likely a result of people not being able to sleep inside. But I do want to ask, in your discussions with BC Housing, and you're aware that that some of us have met with Minister Eby 3 times in the last 6 or 7 months, and most recently during the UBCM consultations. And we did receive a bit of a glimmer of hope that BC Housing might be interested in looking at a purpose-built shelter. And I'm just wondering if that has come up in any of your discussions, given the inadequacy of the present location and the desire that we all have to see a proper facility that will help to address many of the needs that are currently going unmet.
I too was very happy to, there might be that glimmer of hope, and to be honest with you, we haven't I haven't been in discussion with BC Housing specifically about that longer term solution and purpose built facility, but it absolutely needs to happen. And to be honest, since you shared that glimmer of hope, it has been really full on dealing with staffing, lack of labor, and the opioid, or not opioid, well, that too, the crisis, but also the COVID crisis right now in the last few weeks amongst the vulnerable population has taken all of our time and energy. And part of that was negotiating additional rooms for COVID isolation for the no fixed address COVID positive people. And so those have been where our conversations have been mainly focused recently, but I never miss an opportunity to remind them this is not the permanent solution. We need to look beyond this. So
Thanks.
yeah.
I'll follow that up by asking, given the concerns about labor shortage, how confident are you that you can actually staff the center if it does become a 24/7 facility with overnight accommodation?
Well, I wasn't very confident last year, and we did it. And so part of the challenge has been this waiting of, are we, you know, is it going to happen? Is it not going to happen? And we can't make commitments to staff, but we're in the process of trying to do that. And it is also a significant challenge to staff up a program that operates dependent on the weather. You know, there's a lot of competition for jobs, or there's a lot of jobs out there. We're all competing in the same pool. If we can offer people something other than you'll work if the weather's bad, if we can offer full-time with benefits, with, you know, over, you know, once the waiting periods, we can offer a pension. I think we can attract the staff. It's just being in this holding pattern, or we're not sure if you'll work full-time or 1 day a week. I mean, we can be predictive, but it's certainly nice to say, hey, look, this is what I've got, a full-time job with pensions and benefits. And I think honestly, the labor force in our sector should be negotiating a premium for working overnights, if I had to put something on the table for negotiations.
Heather, finally, I really appreciate the outreach outreach that you've undertaken with individual business people and others in the area who have been concerned about community safety. And I think your involvement in the Downtown Business Association is a positive move in that regard. I do want to ask finally, though, that you mentioned COVID outbreaks. If you could just speak to what the situation is with COVID in relation to our unhoused population that you're coming into contact with these days.
Certainly. As of Friday, I began to be invited to the Comox Valley COVID cluster huddles every morning. So I've only been at 2, but this morning they reported 17 active or COVID positive cases in the no fixed address or supportive housing facilities. So the Junction, the Travel Lodge, and then no fixed address, as well as amongst staff in those places. I added to that we've had a COVID positive staff person at the Travel Lodge. Just as this call was starting, we have a COVID positive staff person at a Connect. And we also have 2 COVID positive staff, so far no clients, at Amethyst House. It's really challenging as a community provider because we are not on the inner circle in Island Health, and specifics of who these individuals are not shared with us. And of course, if they're in our own facility, we know, but beyond that, we don't know exactly who it is out there who are no fixed address and frequenting Connect. Hence, you may have noticed today I had security outside of Connect just to help manage the safety protocols of people going in and out of the building. Yeah, so it's a bit frightening at the moment in my mind, but yeah, we're doing our best to encourage people to become vaccinated. I think the day that we had our first COVID case at the Travel Lodge, Deb managed to get 9 people vaccinated. Island Health is working on more outreach vaccinations. I took clients to be tested today. There's a mix of people who are sick who have been fully vaccinated and who have not been fully vaccinated.
Thanks, Heather.
So also, just so you know, BC Housing is looped into these morning huddles along with Island Health.
Thanks for all that work, and just wish you all the best in hanging in there as we continue to work together.
Thank you.
Thanks, Councillor Hillian. And yeah, I spoke with one of the emerge doctors last week who said they had 45 people the night before in emergency that really she didn't feel should have been there. But there was no place else for them to go. And then on top of that, there's, this COVID outbreak that seems to be happening as well. So it's sort of one thing on top of another, and just the pressure that the system is under right now is immense. So I just really want to appreciate that. Councillor Cole Hamilton.
Yeah, thank you, Mayor, and thanks very much, Heather, for the presentation and for all that you're doing in the community. And from your discussion with Councillor Hillian, it seems like we're all in agreement that a permanent solution for supportive housing with the support of BC Housing is really the solution that I think everyone around the table is looking for. But in the meantime, obviously Connect provides a really important stopgap in providing emergency shelter when it's needed. I just wanted to ask about, I know that the Transition Society received the Healthy Communities grant recently, and I was wondering if those funds, what impact they might have on the ability of Connect to minimize some of the impact on neighbors. And I just want to preface that by saying I think it's a fantastic move of yours to be to join the board of the BIA and have that direct conversation around the table. There's no substitute for being there and being able to talk back and forth. And I'm the council liaison to the BIA, and there are some frustrations there, but there's also a remarkable degree of understanding and empathy. And I think that having you there at the table is going to be a great addition to those discussions. So thank you. But I guess the sort of coming back to the question, how do you think the Healthy Communities Grant might impact the ability of Connect to work well with the neighboring community?
Yeah, it's a good question. So there were kind of 3 elements or 4 to the Strengthening Communities Grant, one being around Connect and the actual operations of that. And I can say that we have already, the grant funds are being used to have expanded our hours so that we have people there early in the morning now, and they're decamping and whatnot, and later into the day. A significant amount of that grant was to be put out to the overnight shelter piece. And so not only do we have the offer of BC Housing to fund the temporary shelter, we have funding from the Strengthening Communities Grant to also operate overnight. And the stumbling block is the code and the emergency status and all those things that you'll hear more about from the report, I imagine. There is a focus on peer engagement. And so fortunately, I'm not taking on all of those pieces. So that work is starting. And also the community engagement piece of the Strengthening Communities Grant. And then of course the training for municipal staff and other parties who are directly interacting with this population. So the grant will have an impact, both in terms of public awareness and hopefully, and also peer engagement and street cleanups and whatnot. So all those pieces are just starting to get underway in terms of planning. But there will be a positive impact as a result of the grant.
That's great to hear. Thanks, Heather.
Excellent. Thanks, Councillor Cole-Hamilton and Councillor Moran.
Great, thank you, Mayor. Thank you so much, Heather, for the update and the strong ask, which is important. Some of the things I heard and took away were around kind of the sense of community that people feel down in this area and a sense of safety. And we know that people who are dying from just to distinguish that not everybody who's unhoused struggles with addiction, but we know many do, that folks who are behind closed doors alone are the folks who are dying. So it doesn't surprise me that people would want to gather in numbers for safety and to be close to the downtown core where maybe there would be somebody around with an naloxone kit, etc. So I really hear your point about having more safe places to use, because we're not going to stop that, and people need those places. And just the services, I guess, that connect around, people being able to have a little nap or have some food or connection. The other piece, we talk about shelters and it's not a solution because it's not a home for people, but just when Deb mentioned how, I think she said 8 people moved into Travelodge. And of course, we don't have housing for every person who's unhoused, but it shows you that with those services, people do move into somewhat more permanent housing. And then that continuum, carries on, where if we have the housing made available, eventually people will get into, with a proper roof over their head. So I think that those connections that are made at Connect are so important to helping people, I think, along that continuum. So I really hear that and I agree with that.
Around the COVID piece, I'm wondering what is being done for COVID, for the folks who are unhoused around where they go if they're in the hospital and then they're released. Like if you're unhoused, how do you isolate? How, you know, what's happening for folks in that population who have COVID and need to need to be cared for and isolate?
As I said, when we've heard the first positive case of somebody who was unhoused, I booked on Expedia to Travelodge rooms for a month, and since then, with the work of Island Health and community advocating, they've added 6 additional rooms at the Travelodge that are strictly for no fixed address COVID positive cases for isolation. So those rooms are available, and Deb is the point person, or her phone number on the weekends and evenings for the hospital, or if it, wherever that person shows up as COVID positive and no fixed address, that's an option. We have we've got the funding for that from BC Housing in addition to more security, because one of the things that's happened in the absence of people having a place to say, sorry, I'm getting back to just generally Connect, is that when Connect's not open overnight and there's no place for them to sleep, they're trying to get into the Travelodge by stealthily into their friends' rooms, and that's what creates the challenges over at the Travelodge. So in anticipation of having more people staying there with COVID and this COVID crisis, we have also upped the security. So I hope that so it's these 6 rooms, and they're very temporary. They're signing a temporary housing agreement that ends on their date of no longer needing to isolate, which is generally 10 days, but could vary. Like we have a staff person who's being told they have to isolate for 20 days based on their health status. So anyways, it ends when their isolation period is over, so that we can get more people through. And I will throw out there that although it's not the best solution either, there's an opportunity to take over if BC Housing agrees, the entire motel to support with the appropriate level of staffing and security, of course, the entire Travelodge. The owner is open to that, and it would allow us to take more of these people, like the ones that Deb has identified, who we really built relationship with, a trusting relationship. We understood their needs, could assess their appropriateness for the Travelodge, and move them into that housing once it's deemed appropriate. And I will say too, that beyond that, we are sitting at the community access table for the junction, reviewing all the folks who have active applications to supportive housing, some of whom are in the Travelodge, some who are unhoused, but who will be the next person to take a room, or who will we fill the empty room at the junction, so that we have also moved some people from Travelodge into the junction, where there's an added layer of security and support. So it's a real, just speaking more again to the continuum of housing, and sheltering is a piece of that, as is transitional housing like the Travelodge, and then more supportive housing, and hopefully beyond that, independent for some others.
Great, thank you.
Thanks very much. And Councillor Frisch.
Yeah, thanks, Mayor, and thanks, Heather, for the presentation. You had mentioned the inhalation site or lack thereof, and I don't know if you were saying that maybe you guys were interested in operating one or not. Could you just clarify that?
I wasn't saying that we were interested in operating one. We have become, we are safe inhalation site across the street outdoors in front of Connect because, or across, close by because of the safety that we provide. It daily people are running into Connect saying there's a drug poisoning, someone's down, our staff are running out, creating safety support. We're there on the front lines doing the work really of folks that they would be doing at a safe inhalation site, yet we don't get funded to do it. We don't have the resources or the training to do it. So no, I'm not necessarily saying we would do it or want to do it. We are doing it. And there needs to be an official inhalation site. And I read, was there another new inhalation site in Victoria this week? And they said right in the article that it's been since 2017, that inhalation, and all these people who are way more expert than I are going to speak later about the drug strategy, but it's a significant contributor, inhalation, to the deaths. And we've known that since 2017. And we, along with Nanaimo, are the only communities on Vancouver Island that don't have an inhalation site, supervised inhalation site.
Thanks for
Or
that.
overdose prevention site.
Appreciate it.
Thanks, Councillor Frisch and Councillor Cole Hamilton.
Yeah. Thanks, Matt. Thanks, Heather. I just wanted to follow up a bit more on this, the safe ventilation site. Do you have any idea why it is that Nanaimo and Courtenay would be the communities out of all of the island that do not have safe inhalation sites? And I was wondering if you've been in conversations with the province about that, what the answer was, and whether there was any possibility of having a safe inhalation site at the OPS site that currently exists. I understand their concerns about the hours, but I was wondering why it is that even when they're open, that's not an option that's available. Is that something they've spoken to you about?
I don't think, Will, that I'm really qualified to answer that question. We're just at the other end of it, of not having one and doing it. I know that the CAT and perhaps the drug strategy, lots of people are talking about it in the community and talking with Island Health about it. But yeah, I would ask those questions of the drug strategy or Island Health. I'm not certain of the reasons.
Okay, great. Thanks, Heather. We'll do that then.
And there's been a comment that the substance use committee will have some data on that later on. Perfect. So, but I think we've probably,
sorry, through the mayor to council, we have followed up with VHA on safe inhalation site. There's meetings planned.
Yeah, so thanks for that. But I don't see, Councillor Theos, under the wire, just.
Yeah, well, here with Jeff, so I gave an opportunity. I was going to ask you, there's been some discussion about the outreach communication with the downtown business area. Can I ask you please about what type of outreach and communication is happening around the Travelodge area? Because of course, a number of businesses and citizens in that area have expressed concerns. So maybe if I can hear an answer, I can actually provide it back to those people. That'd be lovely. Thank you.
So I haven't done a lot of outreach recently, but early days, speaking to tenants in the malls, returning calls to inquiries, and providing our information, like contact information. And most recently I had an inquiry from the chamber and had a lengthy conversation with Diane Hawkins about it, and offered to come and speak to the chamber or whatever other group was gathering, but I'm very happy to engage when people call me, or I'm happy for you to hand out my phone number or say, call Heather. Here's your number. I'm happy to have the conversations. But if I don't know that there are concerns, you know, I have a lot of other things to do. And one of the actions in the Strengthening Communities grant in terms of outreach and community awareness is to target that community around the travel lodge. So there will be work coming, more intentional work coming with the Strengthening Communities grant around that particular neighborhood.
Thank you very much.
Thanks, Councillor Hillian, and Councillor Theos. Councillor Hillian, you're next.
Thanks, Mayor. Just a quick comment. I know Deb has been sitting there patiently through all of this, and I just wanted to assure you, Deb, that my gratitude to Heather and acknowledgement of the stress and the challenge that she's dealing with is applied equally to you. And I just thank you for all the work you're doing on the front lines, serving people during this very, very difficult time.
Thank you.
Yeah, I'll end off by saying that the Transition Society has the best staff ever.
And thanks so much, Heather. Thanks, Councillor Hillian, for mentioning that. And I think, you know, in to Councillor Theos's question about, you know, what can people do, or how's that outreach? I can say from my personal experience, when there's been an issue and it's been brought to my attention, I've reached out to Heather personally, and if the issue hasn't already been addressed, because sometimes if she's already aware of it, it's already been addressed. It's like fairly immediate. We're on the phone, we're talking. You know, if the RCMP have to be involved, all those kinds of things, they're certainly happening. And I think one of the big things when we talk about things that say that are within the control of the Transition Society, I would say that I have the utmost faith that they're doing a fantastic job. Where the challenge comes in is there's things that may be outside of the scope. So where people may feel unsafe, or there may be some criminal activity. And that's where we need to make sure that people are notifying the RCMP and the authorities to make sure that those types of issues are being dealt with by the proper people. And I think that's the message that we've had on a variety of issues within our city. So with that, I think I'm going to let you off the hook, Heather and Deb, and thank you again for all the amazing work that you guys have been doing. And I know the questions about safe consumption sites, safe inhalation sites, those kinds of things are very challenging, but hopefully we can make some movement on that. So with that, I hope you guys have a great night.
Thank you. And thank you for all the work the city's been doing again, and a great partnership that we have.
Absolutely. It goes both ways. And again, I know, I think Councillor Hillian may have mentioned it before, but again, the city has some great staff that are working very closely to help. All right, with that, we'll move into our staff presentations. And our first one is recreation, the report back on phase 1 of the community substance use strategy.
Move receipt. Second.
Excellent. That's been moved and seconded. And I'll pass it over to staff, Mr. Carter.
Thank you. Through the mayor and council, we have a presentation to begin, and we'll follow up with staff. Ms. Saunders is on the line as well. I think she might do the initial introduction.
Great. Thank you. Through the CAO to mayor and council, I'll just provide a brief introduction and then hand over to Lindsay McGinn, the facilitator with the Comox Valley Community Health Network, and the rest of the presenting team. But I do want to just provide a bit of background on the staff report. So the purpose of the report is to share with council the Community Substance Use Strategy Phase 1 report, as well as have council affirm its continued financial and in-kind support of the Community Health Network in the next phase of development and implementation of a community substance use strategy for the Comox Valley. As many of you know, the community drug strategy was initially formed in 2002 with the financial support of the city of Courtenay, and in the years since accomplished many significant items, including community education, awareness, and partnership building. And annual funding has been contributed to the Community Drug Strategy and Community Drug Strategy Committee since that time through the city's operating budget. In 2019, the city recognized the need for a regional substance use strategy that had a broader scope. Part of the impetus was the current state of both the provincial and local opioid crisis. And so through conversation with the Community Health Network, the city entered into an MOU with the Health Network to begin the work of developing a regional community substance use strategy focused on reducing substance use related harms from substances including alcohol, tobacco, prescription, and illicit drugs. And so what you'll see today and hear more from Lindsay and the rest of the group is a result of phase 1 of that strategy, as well as recommendations for moving forward with phase 2. You'll see in the staff report that staff are recommending council continue its financial and in-kind support of the community substance use strategy by including up to $30,000 for consideration in the 2022 operating budget. And as you'll see in the report, $15,000 of that is actually carry forward from 2021, so unspent funds from the current year, and $15,000 would be included in the 2022 operating budget as an ask to continue the level of funding we provided historically and facilitate phase 2 of this work. Additionally, staff is recommending that council direct staff to continue supporting this work with our in-kind staff resources and signing an updated MOU with the Health Network to reflect the terms of reference for the next phase of work. So with that, I'll wrap up sort of the staff comments and pass it over to Lindsay and the team to present the findings of phase 1 and introduce the rest of the presenting panel.
Thanks, Susie. You do it so quick, and now I'm going to ramble on for a bit. Hi, everyone. My name is Lindsay McGinn. I am the facilitator of the Comox Valley Community Health Network, but I'm here today on behalf of the Community Substance Use Strategy Committee. And I just wanted to say a quick hello to everyone on the committee who is watching from home today. And supporting this work. So I am here today to present, and with me I have Evan Jolicoeur. Evan was the project consultant for this phase 1 report, and he has actually now come on as a volunteer member of our committee.
I also am here with Ali Reeder, and Ali is a peer who has been working on our working group with us in developing this report. And I also just wanted to thank the Walk With Me group for sticking around today to support us as we are moving forward in a partnership. So we've come to you today with 2 reports, and we hope that never happens again as we try to work to get out of these silos and work more collaboratively together. So thank you to Walk With Me. Thank you specifically to Barb for welcoming us here today and for supporting us in this work. I also just wanted to get a thanks in quick to Mayor and Council for your support in the development of this strategy, both financially as well as through the participation of Councillors Cole Hamilton and Lauren. And also a thank you to city staff, both Susie and Joy Chan, for their support in this work. It has been extremely helpful. So I'm just going to start sharing the presentation. If I can do that. Sorry, just 1 second. So we're here today to submit our phase 1 report for the community substance use strategy. The first phase was really a chance for us to lay our foundation as a group and to start the work of community engagement. So we did present to you previously on some of the work that we were doing, but basically the work started with an opportunity to partner with the Canadian Drug Policy Coalition that was actually brought to us by Councillor Warren. After that work, the group really had to come together to develop a vision, mission, belief, and guiding principles. And this wasn't an easy task. The committee is made up of a diverse group of community agencies and organizations who have different perspectives and views on this work. So we feel quite proud that we have come together as a committee to stand together in our beliefs and how we want to move forward in this work. We did hire the consultants Evan and his partner Ali, and also Sarah, to do some research around best practices around substance use strategy development nationally. We've done some review of the current data, trying to be as specific as possible as we can to the Comox Valley. We've collected information on the supports and services around substance use, and then that takes up a significant chunk of the report, as there is a lot of work being done out there. We began our community engagement process, as well as a separate peer engagement process. And then we've also started the work of doing an environmental scan of funding and government priority alignment. So I am going to hand it over now to Evan.
Hi, everyone. Evan Jandikar here. Mayor, you and councillors should have received our report, I think maybe last week. So hopefully you've had a scan. It is a 40-page document, so I recognize it is a deeper read. But again, wanted to just start with my appreciation for council and taking leadership on this issue and using your voices with our provincial counterparts, as well as particularly thanking Councillor Cole Hamilton and Morin for their continued engagement in this process. So as you'll remember, Mayor and Council, we were here in May to present our interim report. And so there has been some significant work done since then, particularly around community engagement, which we'll get to, as well as working with peers and our continued relationship with the Walk With Me project, and ongoing analysis of data. Next slide, Lindsay. So in a phase one report, generally, it does have its limitations. As Susie mentioned, it is not a full strategy yet. We didn't have enough resources to be able to gather commitments and secure accountability and a framework from all the stakeholders involved in addressing substance use in our community. What we did here is an overview of the work done to date by the committee and the different iterations of the committee over the last few decades, framework to address substance use in the committee, why we need a strategy here. Obviously, this is something that we've been talking about for a long time, and that Council and Mayor Wells, you've been advocating for. So we wanted to just really lay that out in terms of the why. The data, so we've assessed as much as we can with the data available, the harms, both economic, health, social, relational, around substance use. So this includes both legalized substances like marijuana, tobacco, vaping, and alcohol, but also illegal and illicit substances. And that a big part of that was also collaborating with the Walk With Me project and really wanting to share their stories that they've been collecting. An assessment of existing supports and services, as Lindsay alluded to, community engagement with both stakeholders and service providers and community members, but also with peers and people with lived and living experiences. Through that community engagement process, we were able to collect and collate and develop some initial ideas and suggestions around how to address some of the harms caused by substance use, the asset analysis, gaps and barriers in our community, and a path forward.
So if you look at substance use and drug strategies from across Canada, you'll notice that they traditionally rely on what's called the 4 pillars model. So the 4 pillars that are traditionally used for substance use strategizing are harm reduction, prevention, treatment, and enforcement. But as we went through the work of developing our strategy, it became very clear that simply relying on the 4 pillars model was not in line with our values and beliefs around traditional knowledge and reconciliation. So we have included both Western and Indigenous harm reduction practices in the report. So we've been very fortunate to have the support of the Indigenous Women Sharing Society and Unbroken Chain participating in our working group and in the development of this report. So one of the models that we'll be using actually comes from the Native Youth Sexual Health Network, and it's called the 4 Fires. And as we began to use these frameworks, it becomes very clear the ways in which Western frameworks don't always address cultural safety and humility in the way that we want to do this work. We've also been in touch with the First Nations Health Authority, and we have their permission to use their Indigenous harm reduction model as well and framework. And we have started to build that connection with that organization to support the work that we want to do in community in a good way.
And yeah, thanks for that, Lindsay. And speaking about a good way, there's a lot of best practices out there around how to engage with folks who are using substances. And Walk With Me is really an exemplified local opportunity for us to learn on how to do that work in a good way. And we have been learning with the committee in collaboration with the Walk With Me project. And so here you'll see on the slide is it's a poster that we put out prior to our community engagement sessions with people who are impacted by substance use, people who are using substances, people with lived and living experiences. And so really we wanted, and you'll see that throughout the report, centering our work around peers. And this is folks who use across the lifespan, both, as I said, substances that are on the legal market and substances that are used in other means. And so we specifically had a consultation with peers to incorporate their voices into the report. You'll notice that, especially around, I believe it's on page 23, there has been some interesting findings that we had in terms of service provision. Having Heather speak is really timely because, and to the questions around Island Health's overdose prevention site, is that there is, yes, on page 25, you'll see in the little green box, we made a special note here that there was a visible and a very common tension between what we're hearing from folks who access services in the community to what we've been hearing from organizations that provide services. So we did make a special note there. It is something that will be required to be looked into further and to facilitate a conversation between service providers and the people that access them. And so really wanting to, again, to center peers, and we have Ali here on the call with us today and others watching. And so we wanted to just thank them and their leadership. It is not an easy thing to both be a part of this work, but also to continue to offer their time and their energy and their story over and over again, in some cases, really for the betterment of our communities and hopefully to move towards action. Next slide really is the crux of our presentation today. So now what, right? You have the report. We've written the report. It is phase 1. Phase 2 is really to get the buy-in from the systems. So we know by far and large, we are very lucky to have, and you'll see that in the first section of the report, the leadership in our community. I've lived all over Vancouver Island. It is a rarity to have this level of agreement locally from elected leaders around the importance of action on this. And so we just wanted to really hone that in and take the opportunity to talk about how we can move to the next piece, which is transitioning to a collaborative, which is the kind of the BC model of addressing substance use harms, partnering with Walk With Me, as I shared, to use their process of engagement that centers peer voices, and also most importantly to support cultural leaders in our communities and a deep-rooted relationship with the Comox First Nation. Focus is wider than the toxic drugs poisoning crisis. We in the Substance Use Committee and this report are talking about all substances, and you'll see that starting on page 20 all the way to page 24, I believe, is the data, and you'll see that most shockingly, it's actually the legalized substances that have the largest strain economically, relationally, socially, and on our hospital system, both in terms of deaths and in terms of stress on the hospital system. And so we are hoping to transition the committee to a larger collaborative bring together all the people that need to be there. Another key piece here is mapping. We did a little bit of that. We need to expand that, as you heard from Heather and from Sharon and the Walk With Me team, is that there is a discrepancy between what we've heard on the ground and what we're seeing from service providers. We need to be able to understand where the redundancies are, and appreciate that counselors are asking those questions. They're important questions. Where are there gaps? How are services related to other services? How specific community organizations work with other organizations, because we can't be working in silos, as Lindsay alluded to. The other important piece here is convening further dialogues between system agents, stakeholders, service delivery organizations and institutions, peers, and people that are impacted and or using or have lived and living experience using substances. Most importantly, securing commitment and a shared accountability, right? We've seen this through different communities across the country and in North America, where there's been real success in addressing this, is that there's shared accountability between all partners. So it's not just on the municipalities, it's not just on community organizations, it's shared equally. That there's an established funding for the continuation of phase 2 and the implementation, really, of a comprehensive Comox Valley community substance use strategy. And what we really need right now, and speaking on behalf of the committee is, as a community, is to move from the goodwill and the good intentions and the general agreements that there's something here going on. It's not good. It's not working. People are dying. There's harm that's happening. And we need to shift from that, right, to do something towards collective action. So that's really phase 2 for us. Phase 3, is the next slide, Lindsay. I skipped ahead, got excited. Is collective action, which is really where, if you talk to folks in this field, you're going to hear that time and time again, is that there's a crisis at hand and we need to do something about it. So deepening our collaboration and commitments amongst all community institutions, including local government, First Nations, RCMP, the school district, Island Health, First Nations Health Authority, and the diverse broad group of community-based organizations and service providers. And this is really it. This is what we need to move towards to create a resilient, healthy, and connected community in our region, is to really say, okay, we know there's a problem. We've got the data. We're on board for this. Now we need to move towards action. And so the last slide here is really for you, Mayor Wells and councillors, is our request. And Susie alluded to the report from staff, but we're hoping to continue to work in the great relationship that Lindsay has with staff. This will look like helping secure funding, organizations, networking, partnering to apply for further grant money from different sources. Continue with the annual funding that we receive from the city. We're going to engage with our key stakeholders to get them on board and committed to addressing community challenges regarding substance use. And that's a key piece here, right? Like, we need your continued leadership. We need your voices, not just amongst the constituents that you serve, but amongst your peers in leadership positions within the organizations we've alluded to. So the RCMP, Island Health, the school district. We need those leaders on board and say, we're going to take some of this on, because it impacts everyone. It impacts our families, our community members. And so one of the minutiae of what that could look like is to commit to this collaborative, to secure local accountability and engagement in the establishment and the implementation of local strategy. There is a role in our research. Municipalities are very engaged in this work. There's a role for continued leadership on the collaborative from council and from, again, continued work with staff. And then we're going to we are going to be doing the same presentation to all the different local governments, the regional district. We're going to share the report. We're going to talk about the next steps, and we're going to ask for support in moving forward to collective action.
Thanks, Evan. And just so you know, Evan, I did send you a couple messages there. Your microphone, when you move your hands, it gives a bunch of crazy feedback. Not so we couldn't hear you, just more that it's distracting. So as awkward as it would seem, and you talk a lot with your hands, but
I'm French. It's a French Canadian in me.
Absolutely. So, but that being said, we do have some questions that have been generated, so I'll pass it over to Councillor Cole Hamilton.
Yeah, thanks very much, Mayor, and thanks Evan and Ali and Lindsay for the presentation. And may not surprise you to hear that I'm very much in favor of the recommendation that we have in our staff report. And if you've had a chance to review it, I think it hits all of the points that were in that last slide as asks from the group. And one question I had is, I mean, this all started off as the Courtenay Drug Strategy Committee, and through discussions, and I was chair of that committee, we decided that there was a need for something more regional, and to reflect the fact that these problems do not simply occur within the bounds of the city of Courtenay. It's all over the valley, and it needs all hands on deck. And Lindsay, from kind of the first meeting we had, it was about trying to bring other groups on board. And I'm just wondering how we, as the city, might be able to support the engagement of other stakeholders who you'd like to see at the table, like Island Health, the RCMP, the school district. Is there a way that we can help to assist in broadening the conversation and bringing other players to the table?
Yeah, thanks for the question. I mean, I think Mayor Wells alluded to it earlier in the meeting when he talked about calling a meeting with all levels of government together. That would be a great opportunity for a conversation to be had about this situation, about housing as well. And I think we've already talked about there are some correlations between the ongoing housing crisis, poverty, and substance use, right? So as a health network, we're always looking at the root causes, substance use, and the harms that we see in our communities and in our homes are downstream from what is happening. It's the outcome. So I think as much as we can get together to have those conversations about things like housing and poverty and stigma and discrimination, that would go a long way. And yeah, I mean, there's going to be some invitations coming and some asks for help. And if we're having trouble getting people to the table, we would always appreciate assistance from the personal relationships and the work relationships that council and staff have in the community. And if there's a way that we can, it's a lot of the work that the health network does, is to try and not take advantage of, but build on relationships that already exist in our community, and to bring people together to have conversation, because that's really, I think, where we need to start. It doesn't feel like action, but I think it is important. And then, the other support will just too is around funding, and so staff support and municipal support to help with funding, because as you know, the health network is not a legal entity. Our money is housed within the regional district, and we are having these conversations there as well. But if there's ever opportunities to partner with the city on bringing additional funds into our community, that would be a request as well. And I see that Evan maybe wants to jump in on that answer.
Yeah, thanks for the question, Councillor Cole-Hamilton. I think the context that I'd like to add to this is that I'd like to bring the voices of our neighbors who are working in this field, and Heather alluded to it. I don't think it can go unnoticed that people are burnt out in this field. People have been fighting this crisis long before the COVID crisis, and Sharon shared that slide of the amount of folks that we've lost to this toxic drug supply in particular. And you can see in our report, alcohol in Comox Valley, tobacco in Comox Valley. It is an ongoing issue. The numbers are going up, deaths and hospitalizations. And people that are carrying a lot of this burden are folks that are in often underpaid, low-waged jobs within our not-for-profit sector, in many of them housed in the city of Courtenay, but serving Comox Valley more broadly. And so I think the context is, in terms of what can council do, is to bring the larger institutional players who have much larger budgets than, say, the Transition Society or AVI or any of our other amazing community groups doing this work, to bring them to the table and to ask them to be part of the accountability of making our community safe and healthy. And so I think that's just the context that I'd add as well.
Okay, well, thank you both. And I'm assuming this passes tonight. I look forward to working with you both, continuing to work with you both on stage 2. So anyway, thanks so much for this evening.
Thanks, Councillor Carl Hamilton and Councillor McCollum.
Thanks, Mayor, and thank you everyone for the report. I think this is a really excellent report, and it's really great to see phase 1 complete and us contemplating what phase 2 is going to look like. I think the suggested contribution from the city to support this work is an investment very well made. You know, I think it's really great actually that we got to hear from the Walk With Me group in advance of contemplating this, because it really ties in that kind of personal impact that doesn't always stand out when we're looking at statistics. I mean, statistics help us understand the problem, but these lived experiences that that we were able to have relayed to us through that project, it really brings home that the individual impact to the people that are experiencing these issues on the street, but also the work of the outreach workers and all the other organizations that are trying to address these problems. So I'm just really pleased to see something in front of us that we can support and take some steps to try and address. I really liked how this report identified the assets that we currently have, that we can look to provide more resources towards, and also how we can leverage those assets to address some of the gaps that we know currently exist in our community. So I think that's what I'm looking forward to seeing in the future, and just want to say thanks for all the work on this. Thanks.
Thanks, Councillor McCollum and Councillor Warren.
Great, thanks, Mayor. I don't think I have a lot to add because folks have really brought up most of the things I wanted to say. One of them was around looking at the impact of the legal substances that you talked about. And I know way back when, at the beginning of our term, Dr. Enns came in and talked to us about alcohol policy, municipal, policy, like when we're doing rezonings and things like that. And I know when I worked in the field, I guess I still do sort of, but I haven't been practicing. We did a lot around tobacco and how to reduce harms and help youth to not start smoking in the first place, so that we wouldn't have all these impacts money-wise and health-wise down the road. So I think there are, we certainly need the help of higher government hugely in this regard. But I think there are things that local governments can do, especially if we all work together to develop some policies that will, first of all, support the work that all the people are doing on the front line. How can we make that easier? How can we reduce stigma, which I think is one of the biggest issues. We don't, say anything about somebody getting their safe supply of alcohol every, weekend or whatever. But we certainly have a lot of judgments as a society about other substances that people use, and there's a hierarchy there that, it's difficult to even look at social media these days, because I saw this week that people were suggesting that we don't feed people with substance use problems, that we take away everything from them. It was very disturbing. And so I'm really happy with these reports that really speak to that issue of stigma. And I think working together, if we can all try to be on the same page and bring these other groups up to speed that you've spoken about, in terms of, folks with different mandates, we can all work together. We're all sort of have the same goal to have a healthy, happy community. I know with our OCP, these social issues can easily be embedded in the planning that we do throughout the community. So I think that it's kind of a no-brainer, in my opinion, to look at these issues. And I just thank you for incredible work. I know I've really enjoyed being, coming to the dialogues and obviously have a personal interest in it because it's touched me hugely in my life. But I'm just thankful to all the amazing people we have in the community doing this great work. So thanks so much.
Thanks, Councillor Moran. Mr. Garbutt, I noticed you had your mic on. My apologies. I wasn't sure if I was.
Mr. Mayor, I just wanted to say that in discussions with staff, this project was before my time. And I would just say I really appreciate the partnership and the good work, both at the interface level, the consultants that did this work, council's direction, and our own staff working in the community. It's really really inspirational to see that type of engagement, as well as that alignment with the wider issues. So I just wanted to express my appreciation new to this outcome.
Thanks, Mr. Garbutt. I appreciate that. And Councillor Hillian.
Thank you, Mayor. Good report, and good to see this evolution of the Drug Strategy Committee, although I have to confess that I do regret the loss of the small grants that the previous incarnation of the committee made to local schools and other groups to encourage prevention activities. I would hope we could find a way to resurrect that aspect of the program moving forward, given the emphasis on prevention that we do want to maintain. But I want to focus my question on page 11 of the report, where you do give a fair amount of credit to the province of BC for policy changes, resource development, and advocacy to the federal government in relation to decriminalization and such. I'm just very curious, in your discussions with Island Health, who is in fact the main provider of substance use programming, treatments, and otherwise, what sort of rationale do they provide that a strategy like this is having to be developed with a few paltry $1,000s from the city of Courtenay, as opposed to a significant injection of staff and resources from that organization?
Who's taking that one? Let me.
Yeah, that's a sensitive one. You go for it, Lindsay.
Actually, what do I want to say about this? When we talk about phase 2 being buy-in from systems, Island Health is one of those systems. So while we have had Island Health staff involved in the committee and in some of our community engagement, that's really one of the main conversations that we want to get into in phase 2. So we had someone, a harm reduction worker from Island Health at our meeting today, who has been incredibly supportive of this project and been an incredible resource for us, talking about burnout in that system as well. But there are some relationships that need to be mended and addressed in our community. And some of those are with Island Health. And I don't think, when we do get together and talk, we all have the same common goals. We all want people to be well, and we want to serve our community. And it's just sometimes looks different from within a big system than it does in the community. But I would say those conversations with Island Health, the work that Walk With Me is already doing in the hospitals, and the model that they have developed to engage in those kind of conversations that bring, what we might call system service seekers together with service providers to find a better way forward, I think is really the key of the work that we want to start doing right away in phase 2.
Yeah, I appreciate that. And I'll just ask 2 more questions. In our meetings with Minister Eby, the Minister of Housing, where we've expressed in the clearest terms possible our inability to cope with the crisis on our streets, created by the lack of servicing and the lack of housing for people who are unhoused and suffering from all these dreadful afflictions. We've been given the information that the province is going to announce and deliver some type of complex care strategy in the next year that is going to try and address some of these challenges that municipalities such as ours are facing. And I'm just wondering if you've been given any advance notice of what that might look like, and if you've got your application ready to help the Comox Valley become a pilot site.
I'm gonna go on that one too. No, I haven't, but I would say yes, we are ready. I think both of these reports put us in a good place to make a move forward. But I think more importantly than that, the relationships that we've built in this community through this work also puts us in a really good place, because what we know from the other groups in the community, our partners at the Coalition to End Homelessness and the Early Years Collaborative, is that governments like to see community speaking with one voice. And so I think, you know, here in the Comox Valley, the work that we're doing through the Health Network, this committee, we're well tied in with the Coalition to End Homelessness. I think we are very well positioned to make a very strong case for funding to come into our community.
Thanks. And a final question. Evan had the pleasure of taking part in a conversation with you about men's health issues back in the spring. And since then, I've spoken to numerous people who I would say are part of the recovery community in the Valley, who would like to be engaged and support people. And I'm just wondering if you see any role and how we might engage many of the good citizens in the community who see these challenges, feel that they may have something to contribute, and would like a way to help.
Yeah, I think absolutely the model that we need to move forward with is all hands and feet and voices and hearts on deck. And I can speak to, again, Heather's comments around the silent crisis that is being faced in this country, I think, which is a labor shortage in this sector, burnout, low wages. And so when I think about managing volunteers, managing connecting mentors, people who have been through treatment, who are on a path of recovery, with folks who are maybe interested, folks who are using substances, that requires someone to coordinate that, right? And from our analysis of the community stakeholders, including the service providers, is that they're at their max with just meeting the immediate needs of their clients. And so what I think it will require is a coordinated effort to connect folks who have gone through a journey of recovery with folks who are maybe interested. And I will again just highlight, it's in our report, but it was also in the Walk With Me report, which is something I think in your conversations with provincial counterparts and the chief medical officer, is that we have a serious lack of medical detox beds in this community. By the time someone can actually get a bed, they've probably changed their mind. And you know, that is a huge barrier for folks to move towards a path of recovery. And so yes, connecting mentors and volunteers with substance use users or people that use substances, but also thinking about how do people even get onto a path of recovery? There needs to be spaces, there needs to be staffing, there needs to be beds available for them, so that when they pick up the phone and call their mentor, or they call their buddy who's gone through recovery and he says, I'm ready, that there's a place for them that's not 3-month wait. I'm not sure, Lindsay, if you have any thoughts on that.
Yeah, I just wanted to say that, you know, some of the most active people on our committee are themselves in long-term recovery. And when we talk about people with living experience of substance use, we're not only talking about people in active addiction or in active use, but who are in recovery themselves. And so, you know, we have representatives from the recovery community who come to our meetings and are participating in this work with us, and our supports to us in this work.
Thanks, I really appreciate that. And I'll just finally say that one of the features of the pandemic has been the inability to bring people together in person, which hopefully is starting to change. But what I've been impressed with time and time again is that when citizens in the community call to express concern about challenges on our streets and our neighborhoods, many of them are willing to do something to help. And I think one of our challenges is how to make good use of that potential, given the crisis that our paid caregivers are suffering. So thanks very much.
Thanks. And I would just point out that this entire, hearing you say that this entire strategy phase 1 report was created and all the work was done without ever meeting in person. So this is 100% Zoomed. We had one in-person peer engagement session, but otherwise this has all happened online, which is actually quite incredible when you think about it.
Fantastic. That's great to hear. It's been a great presentation. I think a good question and answer. I'm going to move that receipt be unanimous unless anybody is opposed to that. And there are some recommendations. Councillor Frisch.
Thanks, Mayor. I'm happy to move that based on today's staff report, phase 1 of the community substance use strategy and request from the Community Health Network for Continued Support Council approve option 1 and receive for information the community substance use strategy phase 1 report, and that council direct to staff to continue to work in partnership with the Community Health Network to support phase 2 and consequent phases of the community substance use strategy, and that annual operating budget funds of up to 30,000 be included in the 22 operating budget and 15,000 annually in the long-term financial plan to support phase 2 and subsequent phases of the strategy, and that staff work with the Community Health Network to adapt the memorandum of understanding with phase 2 deliverables, and that the CAO and Director of Recreation, Culture and Community Services be authorized to execute the memorandum of understanding.
Second. Excellent. That's been moved and seconded. Councillor Moore.
Thank you. Yeah, I obviously support the recommendation. I would like to actually propose that we have discussions during budget time to bump up that a little bit with the added, I guess, strong encouragement of other local governments to kick in some funds as well. I know this committee will work with staff to leverage funds in terms of grants, etc. As you've heard, I mean, there was a lot of kind of volunteer contributions. I know some folks did get paid honorariums, things like that, but I think that we're seeing that this is a huge issue in our community, and it's beyond just what we see on the streets. It kind of weaves through many different policies, both with the city and regionally. And I would like, I mean, we've already been contributing 15,000. This has been a huge project that they've done, I think, quite financially efficiently. And I would like to see us bump up that number, or at least have discussions about bumping up the number. Thank you.
Thanks, Councillor Moore. Any other questions or comments? Seeing none, I'll call the question. All those in favor? Any opposed? And that passes unanimously. Thanks, everyone. And again, thanks, Lindsay and Evan, Ali, who else was there? And Susie, for your introductory remarks, for setting the stage and the work that staff have been doing on all of these things we've been talking about tonight. It's obviously much appreciated by council. So thanks so much. All right, that being said, next thing we have on here is the 685 Cliff Avenue.
I would move the recommendation if that's okay with you, Mayor.
Okay, so it's
another short one. I'll move that based on today's staff report 685.
Oh, yeah, Councillor Gillen. Yeah.
We do have a recommendation from the CAO via email that amends the motion on the agenda somewhat. I'm not sure if Councillor Frisch has that in front of him.
In fact, I don't. Do you want to take care of it?
All right, Councillor Hillian.
Thanks. Now
It's
I have it in front of me. So Mayor, I believe the motion is that based on the October 8th, 2021 staff report, 685 Cliff formal agreement and shelter services, council approve option 1 and delegate authority to staff to transition the current license of occupation agreement between the Comox Valley Transition Society and the city of Courtenay for the property having a legal description of PID 006-102-930, Lot 3, Section 61, Comox District Plan VIP 3817, to a 1 one-year lease agreement with 4 one-year renewal options to permit the consistent operation of the Connect Day Center and an overnight shelter for individuals experiencing homelessness, and that to permit the immediate activation of an extreme weather shelter, council approved the following amendment to the January 6, 2020 license of occupation as amended. Section 19B, if extreme weather occurs during the license of occupation term, then the licensee shall be permitted to operate an extreme weather shelter from 7:30 p.m. to 7:30 a.m. That council exercise their authority under the BC Building Code section 1.1.1.12F4 and exempt the extreme weather response shelter located at 685 Cliff Avenue from the building code, having deemed it to be a temporary emergency facility due to extreme weather conditions, and that the mayor and an officer of the city be authorized to execute all documentation relating to the lease agreement. I hope that covers it.
Second.
Excellent. Thank you, Councillor Hillian, for jumping in, and Councillor Frisch, thanks for trying to get it going. So it's a real team effort. Thanks very much. And with that, I'll pass it over to staff. Mr. Garbutt.
Thank you, Mayor and Council. Ms. O'Connell is going to do an overall introduction to this report, and Ms. Saunders is available as well for information.
Thank you, Your Worship, through you to Council. So today we're once again considering an amendment to the current agreement for the Connect Warming Center and Shelter component. What is unique about this report compared to previous amendments is that we're actually looking to change the form of the agreement from a license of occupation, which has been the past form of agreement, to a lease agreement which includes 1-year renewal terms of 4 years, bringing the total potential lease to 5 years. One of the reasons, or some of the rationale, as outlined in the report for transitioning from a licensed occupation to a lease is you may have heard earlier from Heather that some of the unpredictability of the provision of service or the ability to provide the service has led to concerns and challenges in regard to recruiting staff, retaining staff, providing a sense of business continuity and security to the individuals experiencing homelessness or vulnerable populations accessing those services. So creating a level of predictability in the provision of that service and allowing them to plan appropriately for staffing moving forward. The other component is that in the past, questions of funding have been raised. In the case that we are in today, there is actually funding secured, as you mentioned, through the UBCM Strengthening Community Services Program grant, as well as more recently offered by BC Housing. So these are two pieces that were part of the unknowns in the past extensions, that there was funding for the day center component, but the funding or willingness to fund the overnight shelter was a little bit more precarious. So that's now been solidified through the advocacy work of the nonprofits as well as through council and staff. Some of the benefits, other benefits to the lease is a decrease in work as well. Like you hear Heather saying she's been very busy, she's got lots on her plate. It is the same for staff. So every time we're going through these amendments, you know, Heather is doing a lot of work, we're doing a lot of work. So taking that off of everyone's plate and creating a more stable agreement benefits both organizations. We're also looking to shift some of the impact costs from the city. Basically the difference between what it costs us to maintain that building as a vacant building versus now with it being occupied by Connect and the Warming Center. So you'll see under Schedule 1 that we're attributing more of those costs to Connect and to the Transition Society to try and decrease the financial impact on the city as well. Additionally, and one large thing to note within the public engagement component of the report is through discussions with the Comox Valley Transition Society, and in recognizing that there has been quite a bit of public feedback as well as feedback from the downtown business communities members regarding the impacts of Connect within the community. And the Transition Society has agreed to establish within the first year a community advisory committee as well to actively mitigate any of those unintended consequences through communication, dialogue, and reaction. So thank you very much for introducing the amendment. I was going to speak as to why that amendment was now put forward by staff. And the rationale of making an immediate change to the current license of occupation agreement, even though council is considering transitioning to a lease, is that that one tweak in the language from extension to license of occupation term will allow for the overnight extreme weather shelter component to activate immediately under the previous terms and conditions of the last extreme weather shelter amendment. So that still limits beds to 10. It still requires the fire training and the fire plan, the bed plan. And so we're feeling very confident with just making this one change. We have all of those checks and balances and safety precautions in place to facilitate the immediate opening of the warming center, or sorry, of the overnight shelter component. One of the pieces as well in the report to point out has to do with the provision of regular shelter services. So council, under their authority of an emergency, so which would be the extreme weather event, which would be considered an emergency situation, has the authority under the BC Building Code to exempt the building from code requirements. That said, the provision of regular service, shelter service outside of an emergency circumstance, council doesn't currently have the authority to exempt the regular service of shelter from code requirements. So the activation of a daily regular shelter would require, under the current term or the proposed terms of the lease agreement, would require the building to be brought up to code. That's if we can't identify another emergency provision under which an exemption could be authorized by council, should council wish to do so in the future. And we continue to explore options to bring those to council for your consideration. Aside from that, just to give you some semblance or some information around council's opportunities, should you approve the recommendation this evening to continue to review the agreement with the Transition Society. At the point of each one-year renewal, council would still maintain consent approvals on those agreement renewals moving forward. So if there are some things that are learned or some changes that need to be made year over year, at each renewal point, that's going to be the opportunity to make those adjustments. That said, there's nothing to stop council or the Transition Society from seeking mutually beneficial amendments throughout the term of the lease agreement. And with that, I'll see if Susie Saunders has anything she'd like to ask, and she's shaking her head. So that's the end of my presentation.
Excellent. Thanks so much, Ms. Connell, for your presentation. And I do see that's generated some questions or comments. So Councillor Theos.
Thank you very much, Mayor. Thank you very much, Ms. O'Connell, for your comments. You were quite thorough. I wanted to ask you, along the way of your comments, you may have touched on it, but you talked about the one-year renewals and the fact that there could be some tweaking involved during that time period. And you also talked about the committee that would be set up to communicate with the downtown businesses and possibly consumers of the downtown that may feel affected by this decision. My question's in regards to, as you mentioned about the building code and other issues, size, et cetera, that this is not a very appropriate location for a long-term solution, as we had talked about in the past. So there was some search for another location that might be more appropriate. So my question is, now, is the search for another location that could be a better location, is that now put on the back burner, or is that still actively going to be part of the process moving forward?
Thank you very much, Councillor Theos, for the great question. This has been something that's regularly been raised with the Coalition to End Homelessness as well as the Transition Society. It is very much recognized that homelessness within the community is a regional issue. And through our partnerships and working with the CVRD, with the Coalition and the Transition Society, the search for appropriate or expanded shelter locations is ongoing. On a regular basis, we're finding opportunities, or the Coalition or Transition Society staff are instantly seeing if there are any ways that we can help regarding the zoning or the suitability of the space. This is not all eggs in one basket, if that's the question that you're asking, and definitely they are continuing to look elsewhere because although this may not be purpose-built, it may not be ideal, but it is currently in place. It's a proven model in the past, and it's what we've got for right now. So
much, Ms. Connell, for the answer. Great answer.
Yeah, and just to follow up just a tiny bit there, obviously there was movement in the past of them moving to another location. And again, when we met with the ministers, all the ministers, but in specific, when we were meeting with Minister Malcolmson and Minister Eby, being very clear that this is something that we really need them to put a lot of attention and a lot of effort and resources, specifically financially, so that we can create a purpose-built space for leading with this. So it's something that's where, as a council, that's where we've been really pushing. I think we've got everybody is making sure we have that same message, and I think all those reports we got today really emphasize and support the fact that that's happening. So that and that's really where we have to get that funding from, unfortunately, because it is far outside of our ability to pay for individually.
Yeah, for sure.
With that, Councillor McCollum.
Thanks, Mayor, and thanks so much for the report, Kate. Very happy to support what's outlined here. Certainly hearing from the Transition Society earlier today, it's hard to imagine how we couldn't proceed with the option that we have in front of us with the various crises that they're grappling with and the services that they've been able to provide to our street population. It kind of begs the question, like, what would we do without this in place, and what would the impacts be to downtown if this were to suddenly not be available? It also underscores the fact that we need to continue to seek out better solutions, getting back to our advocacy piece with other levels of government, because it's a very small space and they are doing so much with such a small amount of resources that it's really I mean, I think we heard it from Heather earlier that it's a drop in the bucket compared to what the need is. One thing I don't know if I have a completely firm grasp on understanding is the complications with the BC building code and how that relates to the emergency shelter versus providing this as a regular shelter. And I'm just going to paraphrase what I think I understand, and you can tell me if I have it right. Currently, because it's not up to code, if the emergency or extreme weather response is not in place, are they able to operate this as a shelter, or what is the gap there? Can you explain it to me better?
Thanks, Councillor McCollum. Yes, that is an excellent question as well. And you are correct. So it is the fact that the extreme weather response shelter is deemed an emergency circumstance where there's temperature and weather conditions that are a risk to life through like feels like zero, or those types of weather events. And so under the provincial extreme weather shelter, that's deemed to be an emergency in and of itself, which gives council the authority under the building code to exempt the building from the code. A regular shelter that isn't around a specific emergency situation, we are still exploring with legal what options there are around that. And hopefully we'll have an update for council in the near future as to whether or not we can extend that emergency capability and exemption from the BC building code for other reasons aside from extreme weather or the pandemic, which was tied in the last extension to the provincial state of emergency. So we're still continuing to explore that. But as of the information we have currently today, the extreme weather shelter is the only portion that council has the authority to exempt from the BC building code right now. And regular shelter operations outside of that extreme weather would not be exempted, and therefore to provide them, they would have to bring the building up to code. That can change as legal opinions provide us with more insight and more information as to what the capabilities and options are before council.
Okay, that's very helpful. Thanks for that explanation.
And I think that was one of those unintended consequences that we brought to the province's attention, not just Courtenay, but many other municipalities on our minister meetings, that when those pandemic restrictions or capacities that we had under the pandemic were removed, that these would be some of those unintended consequences. Councillor Hillian.
Thank you, Mayor. I do just want to clarify with staff that there's no intent to move beyond the 10-bed limit, even though we've heard from Heather Nay that that would be asked on their behalf. I wonder if you could just speak to that.
And I see Mr. Garbutt's got his hand up. So
through the Mayor and Councillor Hillian, the limits are based on the building issues, and there are avenues ahead that we can explore that Ms. O'Connell's referencing additional information. We'll come back for that. We've all been made aware through various discussions with BC Housing. There are a number of issues we're certainly underserviced in the area, and we're working with the transition study to go through these steps.
Thanks. So I just want to say that I'm going to support this, but we take this on with some risk. Part of that risk is that we don't have the support of our business community and our citizens. If in fact the challenges in the downtown area, and particularly across from City Hall and such, remain, we have to work on the hope and the belief that with the funding that the Transition Society has, they will be able to make improvement in that situation. That's the hope, but there's some risk. The other risk that we take is that as we provide this service, and we don't know if we're potentially going to get stuck with continuing to provide this service. I would submit that it's not a primary municipality responsibility, but we're in fact stepping into a breach that is created by a lack of services from senior government, and in response to the social conditions that we find in our community. So I think that we mitigate that risk by relentlessly continuing to pursue and push our provincial representatives in government on the need to provide a permanent response to this situation. That would include moving the other shelter out of the residential neighborhood that it's currently in, and building or developing a more permanent purpose-built shelter that would in fact have the space available and the services available to do this job properly. In the meantime, it's a calculated risk, but in my view, the risk that we take by not stepping in when we're able is much greater, and therefore I support the resolution. Thank you.
thanks, Councillor Hillian. And I see Ms. O'Connell, you have your hand up.
Thank you, Your Worship, through you. Just in response to some of the hopes that Councillor Hillian has brought forward. Of course, as a member of the community within Courtenay, we all have those hopes. At the same time, I just want to manage expectations around the Transition Society ability to deal with or potentially deal with all of the ramifications or outcomes of lack of support services within the community. The provision of shelter beds, the provision of expanded shelter beds and or outreach in the community will definitely have a positive income. But in the absence of more extreme interventions as far as addressing the complexity and myriad of issues, it won't be possible to see an instant improvement in all things within the specific location of where these services are being provided.
Can you get a follow-up, Councillor Hillian?
Yeah, thanks to staff. I totally agree, and I think we need to make clear that we're going to continue to experience challenges on our streets in our community until we get the comprehensive programming and resourcing that is needed to resolve the problem. I did want to clarify that in terms of our the impact on to our taxpayers and our city budget. We're not paying operating costs here. That is covered by the grants that Transition Society is receiving from elsewhere. And I believe that what the staff have done to recover such rent as enables us to maintain the costs that we already had for operating this space, which was not being used, but which still remains as a city asset should it be needed for some other purpose. That makes sense and gives our taxpayers some assurance that that we're taking on this in a responsible manner. Thank you.
Thanks, Councillor Helene. I appreciate that. And I think we've had a pretty good fulsome discussion. So I'll call the question. All those in favor? Any opposed? And that passes unanimously. At this point, we are at 6:20, which is just, I think, a little bit behind of the time that we had guessed at. And so at this point, I was going to give it to council if you want to continue on. Otherwise, we could have a meal break. It's your call.
Want to knock off some short items?
Yeah.
All right.
I think we could finish it.
Let's do the force.
Yeah.
Because when, yeah, we can do a bunch more of these. So, yeah.
We just have 2 more items under.
Yep, under staff reports, absolutely. And then the RCMP report is probably going to be a longer one, but we're going to be talking to him twice, so that might be a good break prior to that one. So that being said, zoning amendment bylaw number 3021. Councillor McCollum.
I'll move that based on today's staff report, zoning amendment bylaw number 3021 to allow for a secondary suite at 2099 Hawk Drive. Council approve option 1 and proceed to first and second readings of zoning amendment bylaw number 2021, and that council consider zoning amendment bylaw number 2021 consistent with the city's official community plan, and that council waives the requirement to hold a public hearing with respect to zoning amendment bylaw number 2021 pursuant to section 4672 of the Local Government Act, and direct staff to give notice of the waiver of the public hearing pursuant to section 467 of the Local Government Act in advance of consideration of third reading of the bylaw.
Second.
All right, that's been seconded, and I'll pass it over to Seth. Mr. Garbutt.
Yeah, through the mayor to council, Mr. Fitzgerald's on hand for some questions. And he doesn't need to do a presentation unless council has questions.
Okay. Councillor Kelly.
Thank you, Mayor, and thanks to staff for the report. My primary question is if Mr. Fitzgerald, you could explain to us the justification for waiving the public hearing requirement and what sort of response we've had from the neighborhood in relation to this request and any further comments related to that aspect. Thanks.
Yeah, thanks for the question through the CAO to Mayor and Council. So in this case, as a result of the alternative public information meeting process, one comment was received in opposition to the proposal. The concern was to do with parking, which is something we commonly do see with suite rezoning proposals. So our justification based on there only being one comment in opposition to propose waiving the public hearing. Now, when we waive the public hearing, we still advertise that in the newspaper, and notices are provided to adjacent property owners. And should those property owners continue to have a concern, they can again submit comments, and council would see those comments prior to consideration of third reading.
Councillor Henry.
Thanks, Mayor. I note on page 213 of our agenda, we have the letter that was sent by the applicant to the neighbors. And somewhat ironically, the letter says, "Dear neighbor," and it comes from an individual who apparently lives in Fredericton, New Brunswick. So I'm somewhat concerned that we have basically a landlord who doesn't live in the community looking to maximize revenue from this particular situation. And I'm just wondering if staff can give me any reassurance as to whether or not that represents any added concern that we should be aware of.
Yeah, thanks for the question. So I guess, as with all rezoning proposals, we look at it from a land use perspective. And so the use of the house plus a suite would be the same if this proposal was successful, regardless if the owner was occupy one of the units. So from a staff perspective, and given that it complies with all other zoning parameters, such as on-site parking, we're not concerned with that element.
Thanks. And my final question, the comment from the area resident who does have concerns and expresses opposition goes beyond just speaking about parking and talks about the area in general and the street being an accident waiting to happen. And I wonder if we have anybody from our public works or planning department who can speak to whether or not there's any accuracy to that, if we have anything, any information to allay concerns about that aspect of this resident's concern.
Thanks for the question. I don't have any additional detail from Public Works on that. If there are any visibility concerns, that's something that we could follow up with in conjunction with third reading if this application goes that way.
Mr. Garbutt.
Thank you. Through Mayor to Councillor Hilling's question. So the advertising process will solicit additional input from people. Should that be a comment? I recall from my time previously about the Hobson Hawk 500. So this is an area that has had some question around traffic. There's been improvements made there. The road was disconnected from Lerwick. So we have a fairly good understanding of the traffic issues in that area. So I believe through the advertising process, we'll hear if that is a wider concern.
Thanks very much.
Excellent. And Councillor Theos.
Yeah, no, I appreciate Councillor Hilling's questions, and part of those questions are based on the fact that that we often hear from people that are saying that we don't even give out a large enough web of our letters of recognition, the fact that we're going to be looking at a zoning change of any kind. So to not even have a public hearing and waive that, I do find concern with that in the process itself. Yeah, I know many people have talked about whether we should just have a broad based policy on just allowing secondary suites just all throughout the community. And if we did that, then that would take away this question. But at the moment, we don't have that. And I still prefer to give the public a chance to, excuse me, to make their presentation at a public hearing and not just cherry pick which ones we will allow and won't allow. So I would be supporting having that public hearing, and we do it in a way that's combining with other public hearings, and it wouldn't be taking up much time if someone does or if people do not show up. So that would be the direction I would go in.
Mr. Garbutt.
We would, of course, take council's direction in that regard. With respect to these types of issues, they go directly towards affordability and housing availability. I guess I would note staff's analysis is clear that notwithstanding the fact a public hearing may or may not occur, the same notification goes, newspaper notification as well, and the feedback from people would be provided to council through that regard. So it's other than the holding of a public hearing, notification is provided, people have input and the ability to do that. So I just provided that for clarification. There are some steps that some people in the development community have identified that these are ways to speed things through, but it doesn't diminish the accessibility or information available. The same people get the same information.
Thanks for that clarity. Councillor Hillian.
Yeah, thanks, Mayor. Councillor Theos makes some good points. I am going to support the recommendation though, because it's been our experience, I believe, of late that with these types of applications, most of the feedback we get is in writing via email from people. And I think as long as the notices go out to individuals concerned and there's advertising in the paper, it gives that opportunity. And as our CEO notes, if the concerns expressed by the one individual are widespread, people do have an opportunity to express that. And on that basis, I'll support the recommendation. Thanks.
Thanks for that. And Councillor Theos.
Yeah, thank you very much. I just want to ask in regards to if we do pass them first and second, and we do say we're going to move forward without a public hearing, and there's a lot of communication generated. If that was to be the case, is it possible at that point to have a public hearing, or once we say no at this stage, would that be the end of it? And secondly, without a public hearing, and let's say we do get feedback from the public, then that doesn't prevent us from communicating even broader with the public because there wasn't a public hearing. So after a public hearing, we wouldn't be able to have that communication. Whereas if we don't have one now, until the third and fourth vote, we could actually have open communication with the people in that area. Is that also true?
Well, I'm gonna attempt to answer that question, and maybe Mr. Fitzgerald can go forward. So in terms of the first component of your question, I guess I'll get to the latter. If we don't host a public hearing, the procedural rules related to information following the public hearing wouldn't be applicable. So you'll consider first and second reading. We would do the notification. The third reading would come back, and staff would provide the outcome of that notification. So the procedural rules, I believe, would be the case. And so if you're asking if you're contacted by a resident, or would you solicit input from the neighborhood, I'm not entirely sure what you would do, but you wouldn't be bound by the same procedural requirements following a public hearing. Can you correct me if I'm wrong, Mr. Fitzgerald?
Thank you. Actually, I see Ms. O'Connell has her hand up there and maybe has some more.
Thank you, Your Worship, through you. CAO Garbett is correct. The other caveat or item to be mindful of is should you get past third reading, so you would be doing third and fourth reading potentially separate, that any amendments to the bylaw would need to be done at second reading. So say council were to pass third reading, receive further information, and decide you wanted to amend the bylaw, you would then have to repeal third reading of the bylaw and go back to second reading, which could result in substantial delays if that was to become a cycle or a pattern. So it's totally possible, it's just something to be mindful of, that there are certain stages at which a bylaw is appropriate to be amended at, and other stages that would have to be rescinded in order to go back and make changes appropriately.
Thanks. All right. Excellent. Well, thanks everybody for the questions and comments and the feedback from staff to provide some clarity. With that, I will call the question. All those in favor? And any opposed? And that passes unanimously. Excellent. Next, we have development variance permit. Well, there's a whole bunch of them on Courtenay Crescent, so I'll let Councillor Cole Hamilton have this one.
Could we move receipt on this one?
Sure.
Yeah, if you're okay with that.
Move receipt.
Yeah, that's second.
Moved and seconded. I'll pass it over to staff. Mr. Garbett.
Thank you. Through the mayor to council, this is I think it'd be important for Mr. Fitzgerald to give a background on this application. Mr. Fitzgerald.
Yeah, thank you. Through the CAO to mayor and council. So this variance request is to reduce the rear yard setback for future homes to be built on 10 lots along Courtenay Crescent, which is a newly developed subdivision. The variance request will allow the houses to be constructed closer to the rear property line than what's currently allowed. Currently, they're required a 12-meter setback from that rear property line. And they'd be proposing to reduce that to a 10-meter setback from that rear property line for all 10 of those lots. The applicant provides the rationale that the reduced setback will allow for larger buildable areas and also promote more flexibility in the design of the future houses. The applicant did host an alternative public information meetings for this application, and one comment was received opposed to the rezone or to the variance request, citing concerns with the reduced buffer from the adjacent agricultural land. I guess regarding that buffer, as the subdivision design was developed, there's a 15-meter strip of park at the rear of these lots, between the lots and the agricultural land. And then the intent was that there'd be a further 12 meters between the rear property line and where the house could start, resulting in a maximum of a 27-meter buffer between the agricultural land and the house, the envelope for the house. And so as proposed here, that would be reduced generally by 2 meters. There is some variation in the buffer, but it would be general 2-meter reduction in that buffer. And I should add that that buffer is also an area for tree retention, and that tree retention extends throughout the buffer, but also onto the private properties. And that those areas are under a covenant area, so the trees have to be maintained. Staff are recommending approval of this variance as they will have minimum impact on the character of the overall streetscape. They will promote flexibility in design of the future houses, and maintaining the treed and fenced buffer at the back of the houses will maintain a buffer from the agricultural land. And without any questions.
Excellent. Thanks so much, Mr. Fitzgerald, and Councillor Frisch.
Yeah, thanks, Mayor. I'm just wondering what the front yard setbacks are on those lots, and if there's any reason why they, we didn't make accommodations on that side.
Thanks for the question through CAO to Mayor and Council. So the required front yard is 4.5 meters. It was already quite not as long as a typical front yard setback. So there really isn't any room to go forward more.
Okay, well, that makes sense.
And Councillor Cole Hamilton.
Yeah, thanks, Mayor. Thanks for the report. I just had one question. I'm looking at the on page 218, this an aerial view of the lots, and I can see the 10 that are indicated. There are also interspersed with them 5 other lots which aren't indicated, and I'm wondering, are those not to be developed, or I'm just curious as to why no variance is being sought for the remainder of the lots.
Thanks for that question. So as part of the subdivision, the developer has sold blocks of lots to various developers or various builders, and this variance application is one of those blocks of lots that were purchased by this particular builder. So as looking forward, council will see there has been additional applications for variances in this subdivision. So council will be seeing future variance applications. But as far as what council is considering at tonight, it would just be for those lots identified.
Great, thank you.
And Councillor Henley.
Thank you, Mayor, and thanks to staff for the report. A couple of questions. First of all, there's a fairly comprehensive report relating to the actual geology of the land, and it seems a little bit more than what we normally see in relation to these types of developments. Number of provisos about the soil and the foundations of any future building. And I'm just wondering if staff could comment on Whether or not this is unusual, is it a reflection of the limited land that's left to develop in the city? Because I know that this is one of the very few areas where new housing is actually being constructed. But it just seemed a lot more detailed with a lot more provisions that needed to be kept in mind by builders than what we normally see.
Yeah, thanks for that question. That is a lot of detail, and the amount of analysis really pertains to the method of stormwater management on the property and how that affects the rear of the property and the type of stormwater management infrastructure being installed. So probably a little bit more detail than you're used to seeing, but not abnormal with an overall subdivision such as this.
Okay, thank you for that reassurance. Secondly, the farmer who lives nearby basically says that I think that they want to be wary of any future complaints about being close to agricultural land, complaints about smells and sounds and that type of thing. And I mean, I would take the position that it's a buyer beware, that if you move into a house next to a farm, you're potentially going to have those experiences. But I'm just wondering if the 2 meters of the variance makes any difference appreciably.
Mr. Fitzgerald, I might weigh in on that. Through Mayor Councilor, I think it's this is important where we have edge planning. A lot of thought and a lot of careful discussion has happened to develop an interface here that people are more than aware. It is interesting how many calls we would get over there is notice on that property very clearly there, and it's actually some good practice that's brought in, recommended by the province, to have nuisance covenants, etc., to make sure that people are aware that there has been a farm and continues to be active agriculture there. It's some of the policies that the province has been asking for implementation, because almost always you have people move in, then you have those subsequent things. So I'm really happy that the original planning went into place by previous staff involved in this. So the distance will have no impact whether they'll have those nuisance issues or not.
Thanks for that. And then finally, this area is basically an extension of the Mission Road area where we've seen a lot of development in recent years. And one of the concerns that's been expressed by some of the people who live there is that although I realize there's still lots of farmland and forest land, I don't believe we actually have any parkland there apart from the strip that you're indicating we'll have a walking path through it at the back of these houses buffering the agricultural land. So I'm just wondering if we have any plans or if the developer is dedicating any land in that area for park usage.
Thanks for the question through CAO to Mayor and Council. So as part of this development, as you indicated, is that strip, that 15-meter buffer, which runs along the perimeter of the subdivision, and it does connect into a pathway network. Will eventually connect all the way to Veterans Memorial. So that's the parkland as currently dedicated as part of this development.
When you say it will eventually connect to Veterans Memorial, yeah, walking paths are great, but what about an actual park where potentially people can take their kids to play, walk their dog, sit on a bench and enjoy the sunshine? Do we have anything like that planned for this general area?
For this general area, I refer to the recreation master plan, which does identify sort of more the Crown Isle Boulevard area further to the east as an area for a potential future park. So that's something that's as that subdivision unfolds, staff will be looking to secure.
Fair enough. Thanks very much.
Excellent. Thanks very much. I think we've had a pretty fulsome discussion. It has been receipt's been moved. I'll assume that we have unanimous consent on receipt, and I'll call or actually, then we can make the motion. Councilor McCollum.
I can move this. I'll base it on, I'll move that based on today's staff report, development variance permit number 2103-3202, 3212, 3216, 3220, 3224, 3228, 3232, 3248, and 3258 and 3304 Kilwan Crescent. Council approve option 1 and issue development variance permit number 2103.
Second.
Excellent. And we've had the discussion. I don't see anybody else. Yeah, nobody else is. Sorry, I saw your mic on, but it's just because you're moving the motion.
I do actually have a question.
Oh, okay. Councilor McCollum.
It's on a related matter that came up with regards to some correspondence that came through with this development variance application that we were notified through email that a property owner wasn't able to receive notice of this variance permit because they're not on title, and some issues were raised around the timing of the completion of the Greenwood trunk. And I won't list off what was raised, but it did kind of flag that we haven't had an update on what the current situation is with that sewer project, and just wondering if staff want to provide a general update.
Take you through the mayor to Councillor McCollum. We'll have a report in November on that to update council.
Thank you.
Thanks for that. Thanks for asking the question, Councilor McCollum. And with that, the motion on the table, I'll call the question. All those in favor? Any opposed? And that passes. Next, we have a letter from the Council of Canadians.
Second.
And I don't know if anybody wants to speak to this. It's a letter with a request. And Councilor Cole Hamilton.
Yeah, Mayor.
Sorry, it's coming. There we go.
Thanks, Mayor. I would move that we draft the requested letter. It seems very much in alignment with our official community plan. And yeah,
I'd second that.
All right.
I know we're on receipt, but
yeah,
no.
Well, I don't think there was an actual receipt on that one.
Yeah.
Okay. Councillor Hillian.
Thanks, Mary. Just in case anybody's watching now or later, this is a letter from the Council of Canadians, essentially asking us to join with them and other local governments and organizations that they've requested to contact the province and ask them to effectively accelerate and upgrade the Clean BC climate plan in response to the accelerated climate crisis that we've experienced this past summer with fires and various other disasters. And it's a fairly comprehensive motion with a significant list of actions. I know it's already been passed by the regional district, and I agree with Councillor Hamilton that it's something that is consistent with our previous declarations and policy. Thanks.
Thanks so much. All right, with that, I'll dispense with the receipt and assume it's unanimous. And if somebody, I'll give back to Councillor Hamilton. You said you were happy to move that we.
Oh, yeah, that's right. I'll move that we draft the requested letter for signature of the mayor to be sent to the premier.
Second. Excellent. All those in favor? Any opposed? And that passes. Next, we have the RCMP quarterly report.
Do we want to adjourn?
I think we are. I was just going to say that was the next thing.
I agree.
Everyone was very eager, but yeah, I do realize we are about 10 to 7. So we will pause the meeting now for recess, and we'll come back as soon as we're done our
as they say.
Yeah, I'm muted and you can't see my mouth moving. That's right.
You're just sitting there as far as he's concerned.
We're going to start in a moment. I just didn't know if you wanted to check your audio or anything like that.
It'd all be good if you can hear me.
Awesome. Yeah, we can hear you. That's great. Okay, well, Neil will give us a heads up here once we're
Excellent.
As they say.
Yeah, I'm muted and you can't see my mouth moving. That's right.
You're just sitting there as far as
we're going to start in a moment. I just didn't know if you. I'm going to close the
Is there
YouTube
always-
video
is
that I
there always
had.
an audio
When I-
delay?
Well, I went to the YouTube to see what was happening because I wanted to make
okay.
sure the video was off, and it wasn't. And so I'm like, so I called Neil and I'm like, hey man, the video's still playing of us walking around, but it was just like that 30-second delay.
Okay. So that was not
You're still live streaming right now.
okay.
Oh, so the audio is live
on YouTube.
Yeah, yes, because we've had a slide up that advises the public that we're in recess.
Gotcha.
So the slide is still up, but all of your audio is streaming.
Good to know.
No problem.
So we're ready to go whenever you'd like to. Just give me the word.
Yep, we're good on this side.
And you're back to live. Just give it a second here.
Thank you, Neil. All right. Just want to welcome everybody back to our regular council meeting. And the next thing on our agenda is the Comox Valley RCMP Q2 report. Thank you, Councilor Frisch.
Second.
Thank you, Councilor Cole Hamilton. It's been moved and seconded. And with that, I'm going to pass it over to Troy Beauregard.
Good evening. It's a pleasure to meet you all finally. It's been long overdue. So the second quarter report consists of the time frame July 1st to September 30th, 2021. And again, as you guys are aware, that these quarterly reports typically include calls for service, various crime types, traffic statistics. These things usually can coincide with our annual performance plan timelines that you are aware of and our strategic priorities in the community. So if there's any questions before I begin.
Councilor Hilling. Oh, yeah. Hang on one second. I just gotta get your mic on there.
Thanks, Mayor. My apologies, but I didn't catch your rank, and I want to make sure that we refer to you appropriately.
Okay, no problem yet. My name is Troy Beauregard. I'm a staff sergeant here with the Comox Valley Detachment. Actually just arrived in January, or I should say the winter last year. Prior to being here, I was actually deployed on an international mission to Ukraine for about, attached to international police for 15 months. And prior to that, immediately I was the operations commander in Campbell River. So upon return from my deployment, I found a home here in the beautiful Comox Valley.
Great. Staff Sergeant was going to be my guest, but thanks very much for clarifying that, and welcome. I appreciate having you here with us tonight.
It's a pleasure to be here.
Excellent. And Councilor Moran, you had
Hi, yeah, obviously, the calls, everything's up a little bit for the most part. Some areas see a pretty significant increase. I was curious if, I mean, you may not have all the details on all the months, but I just noticed there was a real spike in assaults in June. And I guess I'm wondering if you have any qualitative, information that can go along with the numbers as to what, some of these spikes might mean. And then the other question was around I know there's a lot of concerns about the street population and crime, and I just wondered if you had any qualitative information about that, whether there's any linkages there.
Well, statistics are an interesting thing. Can be very hard to put a handle on things. Right, if you're looking just from a numbers perspective, there's usually lots of things you need to look at it from that perspective. June, again, anything putting out there would be strictly sort of speculative without looking or diving deeper with our crime analysts, but increase in assaults in June likely to correlate with running into the first summer months, lessening of restrictions, outdoor parties, things of that nature again would be my first brush response to that. And as for other calls for service, we have, in relation to your second part of your question about crimes and things like that, I have a number of other ones where that sort of call, check well-being, cause disturbance, has had an increase as well over the first 8 months of the year, going to the end of August. Sort of our top three, I could say the top calls for service would be suspicious persons or vehicles or occurrence. Secondly would be traffic or other moving traffic calls. And that's also, again, that's a double-edged sword because a lot of that could be self-generated through our traffic enforcement initiatives. And the third is being check well-being calls and then cause of disturbance. So those are sort of top four calls for service over the first 8 months of the year. That's again going back until January 2021. So not inclusive of just the second quarter report.
Okay. Thanks very much.
Great, thank you.
And any other questions or comments? Councillor Hilling.
Thank you, Mayor, and thanks for the information, Staff Sergeant Beauregard. I'm just curious about whether you do a geographic breakdown at all in your stats, either on the location of the crime itself or the address of the alleged perpetrator. Is that something that's tracked at all?
Yeah, we do have the capability to do that for sure. We can break it down right from as large as you want, from various community to community, right down to a specific address. I haven't prepared that now, but if that's something that council is interested in, we can definitely generate those numbers for you. It's something that I usually like to see, the top sort of places where there are calls for service, because it can indicate that we need to do extra work there, that there's something not working right. I am a fan of statistics and using them, of course, appropriately in conjunction with our analyst and other things. Sometimes it helps us see where the low-hanging fruit, so to speak, may be.
Right.
We also have it divided. Like I said, we can go from large areas. We can generate some analytics that actually show us hotspots or trends in crime types and areas down to, again, like I said, specific addresses or even blocks surrounding specific addresses.
Right. You know, I've got mixed feelings about whether I would actually want that data to be published because, you know, we're obviously aware of not wanting to stigmatize one part of the community over another. But I can see how it would be very useful in terms of where you dedicate your resources and the awareness of hotspots. And of course, what I'd be most interested in would be were there any initiatives we could potentially take in those parts of the community might have an impact over time in changing the numbers. For example, there's been some interest in the possibility of a community police office in the downtown that would have a staff component, but would also have the ability to draw in community volunteers, whether through neighborhood watch or you know, other types of street supports as a way of both engaging our community and also creating more of a presence on the streets, an outreach almost along the lines of one of the school principals who used to ask us to come along and help chaperone at dances. He didn't want us to do anything, just be a presence. And it strikes me that some of the areas in our community where people maybe start to feel unsafe because of what's going on in the street, that if we had regular folk walking there on a regular basis, we create that presence, which has a mitigating impact. Just wonder if you have any thoughts along those lines.
Well, yeah, certainly. I know when I was in my same role up in Campbell River, as some of you may have seen, the opening of the community policing office right in that downtown core there, I believe was a good thing. The bylaw folks were stationed right out of there, and we conducted joint patrols with them, and they can, they got to know some of the people down there very well. That was well received by the BIA in Campbell River, and I certainly think that idea has merit for sure. Visibility is always a good thing, and getting to know again the people that are surrounding a particular area is always beneficial to all parties. And much I listened to some of the presenters earlier, the panelists, and they all hit the nail on the head, and they talked about crime reduction or whatever they're trying to accomplish there being multifaceted, and I adhere to that philosophy as well. You can't have a wheel with only one spoke in it. It takes many spokes to make that big wheel go around and work by everybody. So, if the more people involved, the better as far as we're concerned.
Thanks, I appreciate those points. And of course, when we talk about community safety, we're also talking about safety for the people who are unhoused, who are often some of the most vulnerable and are significant victims of crime themselves. So hopefully it's a conversation we can have further given the resource implications. On a related topic, I'm just wondering if you've heard any news about the provincial situation with regards to auxiliaries and where things stand with that.
There's been no updates that I'm aware of. That program, they were a super valuable resource. We had a really good group of dedicated volunteers in the auxiliary program, and what a great way for especially smaller places, but worked well in places like Comox Valley as well. But to have the knowledge of the community and that involved populace, right, goes back to the old saying, right, the community being the police and the police being the community. Valuable program. I don't know what shape it's going to take. I understand that there's still some work on it, but it definitely won't, from what I'm aware of, won't be the same as we were used to it in the past.
Yeah, that's regrettable, but thanks very much.
And Councillor Theos.
Thank you very much, and thanks for the information, the statistics. I love statistics. But I have a question in regards to with the numbers we're seeing. I did notice that theft from vehicle had a significant decrease, close to 1/3 decrease, and I know that there was some strategic. There was pinpointing on giving messaging to people to ensure that they lock their car doors and to be cautious of where they park, where there's lighting, et cetera, et cetera. The question I have is asking, do you feel that over the last year or two with COVID, was there difficulties in trying to present your message to the public of some of these like break and enters, because you have these strategic plans, prolific offenders, etc. But as in terms of break and enters or the theft from vehicles, is that been affected by COVID as in terms of delivering messaging?
Well, we're fortunate here to have a couple people that are media relations folks. Councilor Courtenay, she does a really good job of gathering what sort of highlights need to go out and getting those PSAs out there. You know, it's I don't know, the messaging is always difficult, I guess. But if you're looking at those crime stats, it may be as simple as 1 or 2 people leaving the community to drive down those numbers that much. So I'm hoping people are getting the idea that, you know, you need to lock your stuff up, absolutely. And could be in conjunction with our bike unit getting out there, that messaging, people realizing they need to lock it, and some people leaving the community, right? All those factors sort of roll into it. It's hard to pinpoint one specific thing. Great to see those numbers down for sure. Anytime we're talking about property crime, but I think we do a decent job of getting the messaging out there when we can. And you know, like I said, it's just one of those things that could be a number of factors rolled into one that created that 32% decrease.
Thank you very much.
Excellent. Thanks, Councillor Theos. And Councillor Moore.
Great, thanks. Just another question that a citizen had asked me about, and that was around bike patrols. I wondered if you had specific areas that you patrolled on a regular basis, or is it kind of all over the map? They were talking particularly around trails, like the Rotary Trail, hoping for a little bit more presence there. But, you know, it's one of those things that maybe the bike patrol goes through and it's all quiet, and then another part of the day, you know, it's not, and it's kind of hit or miss. But I was just curious if there's a particular route or routes that you do on a regular basis.
You know, those bike patrol guys, they're everywhere that they can be. They even tried to get some funding for the unit to get some e-bikes so they could get around faster, and maybe a little less work with all the gear they have to carry as well. But we're quite prepared to put out, you know, $10,000 to $12,000 a bike yet at this point. But they do a really good job, our bikes folks, of figuring out where they need to be. And again, these guys are right ears on the ground and talking to the BIA, they're talking to our partners, they're talking to Connect and the Junction and all these different places. Yes, and they hit all those places that need to be. And they do a really good job of it. You know, our resourcing, as you've heard, is probably, that's been our biggest struggle over the last quarter. Just with vacancies due to injury, illness, and some MATs and PATs, maternity and paternity leave. So if we could have all our boots on the ground, I'd be a very happy guy. And so would some of the other people that are sort of shouldering the work, but they're definitely out there as much as they can. And those bikes guys, you know, they do a good job of getting out everywhere.
Bug in their ear about around Billmore Park. That's where some people were kind of concerned about, but thank you.
Good. I'll make a note of it.
Thanks, Councillor Morin. And I do know that over the last couple of years, when the bike patrols really stepped up, just with my random walks in Sims Park and some of the trails around town, I've come across them quite often. So I do know that they're certainly out there. But as Councillor Morin said, sometimes they can go by at a point in time when nothing's really happening, and then 10 minutes later, you know, some funny business starts up or whatever, and they might have missed it. But I do want to just comment that it is nice that there's been good communication between, I think, the city and the RCMP and all the member agencies of like the Homelessness Coalition, et cetera. So, and like you said, talking with the BIA and just making sure when those concerns are brought to your attention that you guys are responding to it. And that's really our message that we've been really trying to get out there for people, that if they see illegal activity or suspicious activity, to make sure that they're reporting it and not just sort of being armchair quarterback sitting there going like, oh, well, the world's going horrible, but not actually reporting it when they see it. So so hopefully that's having a positive impact, even though it may result in higher calls. I think the reduction in crime is, like you said, you put a couple of these prolific offenders away, or if you get them to stop doing what they're doing, that's going to have a big impact. So yeah. So with that though, I don't think there's a whole lot of other questions or comments. So really want to appreciate you coming by and giving us this report. I'm sure we're going to be talking later on as well, but with that, we'll let you take a bit of a break, and for the rest of the council here, I'll just assume that was for receipt and is unanimously received.
On the motion? I think we did it.
I think we did. Yep.
Sure.
I think that happened. So I think we're good. Next, we do have an internal report, the briefing note on the Fifth Street rehabilitation project.
Move receipt.
Second.
And I'll pass it over to staff, Mr. Garbutt.
Thank you. Through Mayor and Council, Mr. Davidson's on the line with us here. This is a follow-up to the briefing we gave to council last week. And Chris, I don't know if you could please just give us a short intro.
Thank you, Jeff. Through the CAO to Mayor and Council, happy to present this briefing note on the Fifth Street Bridge. For an update on current project status, coating work is generally complete and the third containment was removed today. Following this, the project will move forward into the deck rehabilitation and cathodic protection phase. As part of this, pedestrians will be moved off the bridge deck and back onto the existing bridge sidewalks. Some bad news from the project. Unfortunately, the schedule has slipped further with the planned completion date now being first week of January. Reasons for this schedule extension are that the contractor did not progress as quickly as they had planned through containments number 2 and number 3. Compounding this issue, due to labor shortages, the contractor has not been able to find additional personnel to make up a secondary crew that might have facilitated working double shifts or 24-hour workdays. The construction contract does include provisions for considerations due to the city by the contractor for every day the contractor exceeds the completion date, and we will be pursuing these. We do acknowledge that this schedule slippage is significant and will have an impact on the community. As such, we are working with key stakeholders to see how we can best support them. And we have already started to message this schedule slippage out to the community. Lastly, regarding budget, we are still projecting to complete the works within the approved budget. And with that, I'm happy to take any questions.
Thanks very much for that. And I'm looking around. Councillor Elaine, I saw your hand going towards it. I'll pass it over to you, sir.
Well, thanks, Mayor. I mean, we can't let this go by without some question or comment. And first of all, I want to acknowledge that staff continue to do their best to keep this project on track and to keep us informed. It is regrettable that the information and the confirmation of the further delay didn't come to us until fairly recently, but you know, I do understand that that's not something our staff necessarily had any control over. And I think as we've all learned during these times, supply chain and labor issues are impacting virtually every level of society. I think there's a fairly broad understanding of that in the community, despite what some people may choose to post on social media to the contrary. But I maybe missed this. Could you just confirm what, even though the project's going to be somewhat late, could you confirm what sort of engagement we've had, particularly with downtown business, that change? Were there any accommodations are being made to in response, and what the impact will be on the overall budget of the project? Thanks.
Absolutely. Thank you for the question. Through the CAO to Mayor and Council. Yes, we have had some engagement with the DCBIA. I believe we had 3 meetings in total so far. Currently working closely with them to develop a strategy to support them as best we can using communications. So looking at various options for media, social media posts, and a few other options that we're still working through. But we are dialoguing very well and developing those options. Total impacts to project budget for this. We're not expecting significant cost to the project as a result of this delay. As mentioned, there is a clause in the contract regarding liquidated damages that will help support delays such as this. So, so not looking at a financial hardship as a result of this delay.
Thanks very much.
Mr. Garbutt.
Thank you. Through Mayor and Council, I just want to add a little bit to Mr. Davidson's comments. based on council's direction, we engaged with the BIA leadership and our regular engagement with Councillor Cole Hamilton, as well as the BIA executive director and their executive. And then we followed up with the call to the wider BIA membership last Friday. I think it was very productive, and I think we were able to answer some key questions. And I think we've done a good job of communication to date. We can't look backwards with this delay. However, I think there's some positive components. They're going to be able to continue with some seasonal events downtown, and we're going to help with some communications and support.
Excellent, thanks for that. And Councillor Cole Hamilton.
Yeah, thanks very much, Mayor. And yeah, Mr. Garbutt and I met on 3 separate occasions last week with first the president and the executive director, then the full board, and then any businesses that wanted to attend. And there was a remarkable degree of understanding, obviously disappointment and some frustration, but I think the factors that drove this delay are global supply chain problems to do with some sandblasting. It's not actually sandblasting, but I think it's called media blasting equipment. Media blasting sounds like social media, but anyway, that equipment, there were supply chain problems which caused stoppages, I understand, Chris, and then other equipment was brought in which was less effective, so that slowed things down. And the other factor, as I understand it, is the labor shortage. And I think when speaking with businesses, everyone was experiencing themselves supply chain problems and labor shortages. So these are not surprising to anyone, but they are on the same hand, they are also they were completely unexpected, in the sense that 2 years ago, when we were planning this project, no one could have assumed there would be a global pandemic, which would cause these 2 factors to be as significant as they are. And one other factor that I brought up at those meetings was that because we're on an island, we only received 2 bids on this project. And rather than going with the cheaper of the 2, we asked our staff which bid was most likely to deliver this project on time, given, and which one had the most past experience. And speaking for myself, that was the factor which swayed my decision. If I recall correctly, it was a unanimous decision on that supplier, and that was because we put a high premium on getting this job completed on time. And that's always been our intent. And in this case, we've just come up against 2 wild cards, which could never have been anticipated when we began this project. And I think because of that, there was, again, there was some frustration, some disappointment, but I think also a fair amount of understanding among the business community that these are things which, with the best will in the world, it's just not something that we could change. So, and I appreciate it very much, Chris. You were at, I think you were at all those meetings, and as was Mr. Garbutt. So this was a team effort, and I also think there was great communications work. The press release that came out on Wednesday was very clear, very direct, and in terms of letting the business committee know, I think it was within an hour or so of the press release going out that we were sitting down with the downtown BIA executive to try and sort out the issue and explain and answer any questions that were available. So I think everything's been done to make the best of a very challenging situation. And I just thank staff for their support in responding as effectively as we possibly could. Thanks.
Thanks, Councillor Cole Hamilton. And yeah, I think big kudos for yourself and staff, making sure that those communication lanes are wide open and going forward as well. I think, again, the fact that we got sort of late notification from the contractor, and I know that yourself and staff have been really clear with them that going forward, we need to know when things are having any issues, so that we can like communicate that out to the rest of our community as soon as possible. And one thing that I would highlight right now, just given that I had a meeting with the Minister of Municipalities last week, Josie Osborne, and it was all the municipalities on Vancouver Island that were part of the call. And the number one issue that other municipalities had was the fact that had they not started projects that were supposed to start this year, most of those projects have been delayed indefinitely. Most of them, even if they can start them, the costs have gone through the roof. So the fact that, you know, we did make the decision, we did move forward as quickly as possible, even though we're being delayed here a little bit, we're so much further ahead than other municipalities because of where we are. That's the one saving grace for sure. So, and of course today they actually were unwrapping it, so we get to enjoy the new paint color, which was the old paint color, but now it's just fresh. So, but that being said, I don't see any other questions or comments, and there's no real action that's required from us. So with that, all those in favor of receipt of the report, any opposed? That passes. And we'll go into reports and updates from council. And we'll go through the list, starting with Councillor Cole-Hamilton.
Thanks.
And you're good. Councillor Frisch.
I'm good.
And Councillor Hillian.
Mayor, I'll just acknowledge, and I'm sure you will agree that the Community Justice Center did a superb job last week of hosting the annual Campanula lecture. And several of us were able to attend the different functions with Terry Lynn Williams Davidson, a HIDA activist, lawyer, musician, artist, amazing person who presented a lecture, did an art gallery opening, attended a dinner in her honor, and started a concert on Saturday night, while also working with local students to engage on art projects and engaging in significant interaction with the Comox First Nation members during a very significant week for our community. So it was an honor and a privilege to take part, and our CAO was there for much of it as well. And I just want to give further kudos to the Community Justice Center for that stellar effort.
Excellent. Thanks, Councillor Gillian. And yes, there were other folks there. And in her preparations for this week, which was massive, she also ran 2 marathons, as people do. So she is a highly motivated and capable person. And yeah, it was again a great event. Councillor McCullum.
I'm good now.
And Councillor Moran.
I'll pass.
Okay.
Just in the interest of.
Councillor Theos.
And I'm good too, thanks.
Excellent, that sounds good. Yeah, all I had was that. And there was a Comox Valley Regional District Regional Water Forum that happened last week that I think many of us attended. That's probably worthwhile to talk about, just in terms of talking about water quality, talking about water quantity, and all the work that's going on in the background around that. I mentioned a meeting with Minister Osborne, and then obviously the Community Justice Center event. So with that, we can go into resolutions of council. Councillor Cole-Hamilton.
So everyone sit comfortably and start reading this. So I'll move that a special in-camera meeting closed to public will be held October 18th, 2021 at the conclusion of the regular council meeting pursuant to the following subsections of the community charter. 90 sub 1 sub C, labor relations or other employee relations. 90 sub 1 sub D, the security of the property of the municipality. 91I, the receipt of advice that is subject to solicitor-client privilege, including communications necessary for that purpose. 91K, negotiations and related discussions respecting the proposed provision of municipal service that are at their preliminary stages, and that, in the view of council, could reasonably be expected to harm the interests of the municipality if they were held in public. 91L, discussions with municipal officers and employees respecting municipal objectives, measures, and progress reports for the purpose of preparing an annual report under section 98, brackets, annual municipal report. 90 sub 2 sub B, the consideration of information received and held in confidence relating to negotiations between the municipality and the provincial government, or the federal government, or both, or between a provincial government or the federal government, or both, and a third party. And 90 sub 2 sub D, a matter that under another enactment is such that the public must be excluded from the meeting.
Second.
And Mayor, could I just add as a note that we're not actually going to be debating every single thing for people who are viewing. We're receiving minutes which touch upon them, but otherwise we would be here for the rest of the night.
Absolutely. Thank you, Councillor Cole Hamilton, for climbing that hill of reading that off for us. All those in favor? Any opposed? And we can now move on to new business. And we have a motion to move the location for our council meetings. Councillor McCollum.
Actually, I wanted to back up one item on under unfinished business.
Yep.
We had a delegation from the Comox Valley United Soccer a couple of weeks ago that had two requests, and one was around developing a facility, which I think is a bigger, wider community question that we probably won't tackle today. But there was a second request with that delegation asking that we have a look at existing field use, and I think specifically around Billmore Park was mentioned in the delegation. So I'm wondering if it would be an appropriate time to bring a motion forward just to direct staff to have a look at that.
And I was going to say, I'm going to ask our CAO, Mr. Garbutt.
Thank you, Mr. Mayor, through Councilor McCollum. I appreciate the direction. I think the field use involves a number of parties, but if you directed staff to investigate the matter and come back to council, that would be appreciated.
All right. So
second that if it was made, I think.
I'll make it properly in that case. Less rambly. Yeah, I'll move that we direct staff to review opportunities for maximizing existing playing field facilities, specifically around the Billmore Park suggestion that was raised by the Comox Valley United Soccer delegation.
Second.
It's been moved and seconded. Thanks very much. And Councillor Hilling.
Thanks, Mayor. I certainly appreciate the intent and spirit of the motion, and will support it. I would prefer, though, that items like this are developed as a request to have an item placed on the agenda, as opposed to raised on the fly. I think that enables our staff to be more prepared and for us to actually thoughtfully consider. But I appreciate that it's well intended, and you know, it's the mayor's discretion to allow the motion. So I will support it.
Excellent. Thanks very much. And I mean, technically, it would be more new business because it wasn't on the agenda. Even though if it had been on the agenda, then it would be probably in this section. So, and I think that goes to what part of what Councillor Hillen is saying as well. But again, I think in the spirit of it's a pretty simple motion, and I don't think there's going to be a ton of debate. So with that, all those in favor? Any opposed? And look at that. We are. Thank you, Councillor McCollum, and for your feedback, Councillor Hillen. Getting back to new business, which was kind of what we were just doing. Councillor Frisch.
Thanks, Mayor. I'll move that the following regularly scheduled council meetings take place in the Civic Room at the Comox Valley Regional District Administrative Office Building, located at 770 Harmston Avenue, Courtenay. And those meetings would be October 25th of this year, November 21st, November 1st, thank you, November 15th, basically all of them for the rest of the year, it looks like. And that's it.
Second.
All right, thanks, Councillor Frisch. And we did have a technical run through today, which the wheels didn't seem to fall off, so that was good. So no further questions or comments. All those in, Councillor Hillian.
No, thank you, Mayor. And I apologize because I know it's getting late, but I'm always aware of people watching who don't know why we're doing this. We've read the report. People may not have, although it's on the posted agenda. So just to clarify that staff have recommended this move because partly due to COVID, but partly due to other operational considerations, we can make better use of the regional board chambers in terms of hosting the community, people who want to watch our meetings, and we found ways to operate with the technology there and the space, the greater space that's available that will be in the interests of both the city and our citizens. So really appreciate the work that staff have done to make this possible.
Excellent. Thanks, Councillor Hillian. And in fact, our council did make this motion back in 2017. So on the previous term, we had already started this with the intent that this space as a council chamber wasn't really designed to be a council chamber, but had been basically modified to allow council meetings. And so, yeah, as you mentioned, the regional district office is purpose built and therefore is going to provide a better functionality for ourselves and for our citizens to be able to attend meetings. So thanks for that. With that, I'm going to call the question. All those in favor? Any opposed? That passes. And we're into bylaws. Councillor Moore.
Okay, I will move that zoning amendment bylaw number 2099 Hop Drive, a bylaw to amend zoning bylaw number 2500 2007 to rezone 2099 Hop Drive from residential 1 zone to residential 1S zone to allow for secondary suite, and that schedule number 8 zoning map be amended accordingly, pass first and second reading.
Second that.
It's been first and seconded. Any questions or comments regarding this? Seeing none, all those in favor? Any opposed? And that passes unanimously. For final adoption, Councillor Hillen.
Mr. Mayor, I'll absent myself in the chamber for this bylaw only, as I have a perceived conflict of interest in relation to this.
Okay. And Councillor Moran, I believe.
Yes, same thing. Thank you.
Okay, thank you.
Want us to call you back in after this particular one, Mike? Instead of last
We'll
time?
try not to forget this time. It's a team effort. Councillor Frisch.
Yeah, I'll move that tax exemption 2022 bylaw number 3047/2021, which is a bylaw to exempt certain lands and improvements from taxation for the year 2022, be finally adopted.
Second.
Excellent. Any questions or comments regarding this? Seeing none, all those in favor? Any opposed? And that passes unanimously. And we can call them back in.
I can go around for you.
Will's probably the closest.
All 20 seconds worth.
Not a lot of debate.
Councillor Frisch.
Do the next one?
Yeah, I'll move that tax exemption churches 2022 bylaw number 3048 for 2021, which is to exempt certain land improvements set apart for public worship from taxation for the year 2022, be finally adopted.
Second. Excellent. Any questions or comments regarding this? Seeing none, all those in favor? Any opposed? And that passes. Councillor McCollum.
I'll move tax exemption bylaw number 3049, 2021. Sorry, I'll finish reading it. A bylaw to exempt certain lands and improvements to the extent indicated for the years 2022 to 2031 be finally adopted.
Second.
Excellent. And I do see Councillor Hillian.
Thank you, Mayor. Just to note that this includes the Couscousin property. So it's good to see that we finally have that property exempt from taxes under this bylaw, and it will certainly help the ongoing work of the city with Project Watershed and the Comox First Nation in the rehabilitation efforts of that land, as well as relieving the taxpayer of taking care of those taxes that we have for the last few years. Thank you.
Thanks, Councillor Hillian. With that said, I see no further questions or comments. All those in favor? Any opposed? That passes unanimously with one thing left. Move adjournment.
Second.
All those in favor? Any opposed? And we are adjourned.